Good morning. You all are, I can tell these are mostly school people because you all just came to attention so quickly. Thank you. Happy Good Tuesday morning, everyone. I'm Karen McNeil-Miller. I have the distinct pleasure of being the president and CEO of the Colorado Health Foundation, and I want to welcome you to our Symposium Unplugged, which begs the question, is there a symposium plugged? Yes, but we just call it the symposium. Every year we have a 3-day conference in the summer where we take on a particular topic and we do a broad scope of that topic. This past summer, we did behavioral health and mental health and substance abuse. The Unplugged series is where we go and take a deep dive into one particular aspect of a topic. So today, behavioral health in schools. And I know there's a clicker here for me. And I told you there's a clicker here for me. So those of us at the foundation, I want to give you a little bit of information about us in case you are not aware of who we are. So we're a health foundation in Colorado, based in Denver. And we have just adopted a kind of across the lifespan focus on behavioral health. It's important for us because we heard that topic was the number one topic in every county in the state that we visited about 2 years ago. And it was the only topic that came up in every county in this state. And so it was so important that we had to adopt this particular topic. In addition, about us as a foundation, we have 3 cornerstones that are listed here. We do everything with a health equity lens. It's not enough just to improve health. We've got to improve it for those for whom it is furthest within reach. And so we're trying to close that equity gap. And depending on what the topic is or what the issue is or what the geography is, sometimes that gap is racial, sometimes that gap is geographic, sometimes it's the urban rural gap, sometimes it's language, sometimes it's sexual orientation and across the gender spectrum. So wherever there is an inequity that's health related in the areas that we're focused on, that's what we will be targeting. We also exist to be in service for and on behalf of folks who happen to have the least, folks who find themselves in a condition of poverty. And I'm very specifically use the words find themselves in the condition of poverty. It is a state they find themselves in. It does not define who they are. It is not a statement about their character. It's not a statement about who they are as people. It's just a condition they find themselves in. But that's who we are in existence to serve. And then we want everything we do to be informed by the people that we're trying to help and to work with. So those are the 3 cornerstones that we work with. And then, as I said before, we want to improve the health of Coloradans. We believe that health is a basic human right, and that's broader than health care, which is the national debate. It's not that health care, we're talking about the broader issues of health, including things like housing and food and education. Because those of you who are educators, you're in the health business. Because what you do and the outcomes you create, outcomes you help create, have a direct influence and a direct impact on the upcoming or future health impact and health conditions and outcomes of your folks. Folks with higher degrees there's a direct line of sight between health outcomes. Folks with greater salaries, it's a direct link to health outcome. So you're in the health business, those of you in education, and we want to support you in what, again, we understand is one of, if not the top issue that keeps you all awake at night. So our agenda today I'm really excited about the agenda. So we've got a mix of national experts and local experts. Folks who are, young folks who are living in schools every day and see what's going on with themselves and their peers. We've got 2 national experts going to talk about kind of set the stage and set the table for the national conversation, the national focus on the reality of behavioral health, and particularly how folks who find themselves in poverty, who are in the condition of poverty, how that impacts and contributes to behavioral health and stress in their lives or trauma. So we're going to talk about that. And then this afternoon, we're going to hear from some of you. We're going to have listening sessions. So those of you who are doing exciting, innovating things, we'll give you a chance to sample 3 of the 8 or 9 folks that will be talking. And then we're going to end with kind of a fishbowl where we'll give you the chance to come up on stage and visit with me around some questions and how we as a community, we as a state, how we as a community, and how we as a foundation can begin moving forward in this effort. You all excited? Oh, that didn't sound too good. You all excited? All right, that's better. Right, so we're going to get started right away with Dr. Nancy Lever. She's the co-director of the National Center for Mental Health. I'm not going to do her whole bio because it's much more important to hear from her, but just know that she spent over 20 years working to bring high quality focus on behavioral health in schools at a local, regional, national level, and particularly in working with families in a family-centered approach, because you just can't focus on the child, as we all know, that it's got to be a family-centered approach. So Nancy, welcome.
Good morning, everyone. I am so excited to be here. I do want to thank Karen and, Taryn and Sarah and Hillary and Jacqueline. You have been nothing but hospitable. You're doing fantastic work. It's really an honor to be here. And I love the idea that I get to set the table. It's very exciting. Okay, so what I'm going to try to do is I will describe what is meant by comprehensive school mental health, talk about best practices, talk about some of the resources that are available, and then really consider what are some of the future directions in the field, what are the opportunities, the challenges, some of the policy. And my goal is really, let's start here. How many of you are already excited about school mental health? Okay. Yay! So my goal is, you guys are going to get more excited. And for people, how many people don't know that much about school mental health? Okay, just a few. A lot. You are going to be super duper excited. So we are going to get everyone energized and really thinking. I'm going to give you a lot of information today. My goal is for you to think about it. What can you do with this information? How can you make it practical and adapt it so that it's going to fit within your communities, within your schools? Okay. I have been really fortunate since the beginning of my career. I came to University of Maryland in '95 for 1 year. I came for an internship. I thought I would be there for 1 year. I'm actually now running the program that I interned in. And once I started doing the work, I was doing outpatient mental health work as well as school-based work. It kind of changed everything for me. I'd like to tell you I had this deep interest. I always knew I wanted to work in schools. Instead, I think I had it was a little bit shallow, and I think I might have said something, that sounds interesting, or it might have even been worse, like, that sounds kind of cool to do this mental health work in schools. And it truly has changed the way I look at mental health. And if you're working with children, whether it's in schools or in the community, you need to go where they are. And schools are an incredibly logical, natural place to go to meet with students and help them with their mental health. So we're fortunate to have a national center. We've been continuously funded since 1995 from the Health Resources and Services Administration. And we really, as Karen mentioned, we focus on research, training, policy, and practice at local, state, and national, and even international levels. But our goal is really to advance a shared family, school, community mental health agenda. You can't do any of this work without an amazing team. I truly believe there is nothing you can accomplish if you have the right people working with you, and work needs to be fun. You need to get some enjoyment out of the work that you do. And we've been very fortunate. I co-direct our center with Dr. Sharon Hoover, who's to the left of me, and we've been really fortunate to have an amazing team and to be able to move the work forward over the years. Okay. In terms of the mental health needs of youth, I just want to make sure that we're all on the same page. We know that youth, about 20%, so about 1 in 5 youth, have had a serious emotional or behavioral disorder during their lives. About 10% are going to have significant impairment, so that they're going to have challenges at home, at school, or in the community with their day-to-day functioning. What's remarkable to me is that of these youth, who we already know are having mental health concerns, only about a fifth to a third will actually receive any services. And I'm not even commenting on, are they good services, are they high quality, are they the right services to meet their needs? And what we also know is that for low income and minority youth, and youth in rural communities, they have greater difficulty accessing mental health care. So our numbers are low, but our numbers for low income, minority, and rural youth are even lower for accessing care. When we think about rural communities, one of the things that we know in looking at the literature is, as a whole, rural communities struggle with access. You know, there's fewer skilled providers. Transportation can be a problem. With regard to mental health, the greatest challenge often is psychiatry. Often there's not enough psychiatrists to go around to meet the need. And you're also dealing with challenges accessing, you know, do people have the insurance? Do they have, with poverty in terms of transportation and everything else, is it interfering with them being able to get the care that they need? But it goes deeper than that when you look at rural mental health. There's several questions you need to consider. You know, the first one is, the basic one is, does it exist? Does the care that you know someone needs, does it already exist in that community? But if it does exist, just because it's there doesn't mean it's necessarily accessible. You know, can you actually access those services? Are they easy to, are they convenient? You know, if services are only offered, you know, in the middle of the school day and you need to go every week, that can, you know, that would interfere with the child's education. Affordability, you can have great services, but if no one can afford to pay for them, that's not going to be as helpful. Appropriateness, you know, you can refer for services, but are they doing something that's helpful, meaningful? You know, there's a lot of research being done on what is high quality mental health care. And, you know, supportive care is fantastic, but you also need to make sure that people are learning the skills and necessary strategies in order to do better. Another consideration is acceptability. Does it fit for that community? You can have the services, you can design everything you want, but if the community does not feel that that fits with their culture, with their worldview, and you haven't worked with the community to make sure that whatever you're developing is for them and can be used by them, it's, you know, those are just some of the considerations. It's not easy, but it's important as you're developing services, think about some of these questions and consider, you know, how would that impact the services that you're providing, whether it's in schools or in the community. So Colorado is doing quite well overall. It's much nicer to come to Colorado and say your overall rank across the country is 20th with the kids count data. It's much better than when I've gone to states. It's like, you're number 48, or, it's nice to, 20 is excellent. But what I found kind of surprising when I looked at Colorado's data is if you look at the rank, it went down to 20 because the health category is actually 42nd out of 50. And some of the areas that make up that category include low birth weight, children without health insurance, child and teen death rate, youth who are abusing alcohol and drugs. So I guess one reason I'm bringing that up is to think about there are plenty of ways that you can consider health as you're doing school mental health, as you're doing school health care. And I think you are incredibly well positioned to continue to improve that. And you're very lucky with the Colorado Health Foundation. You have people who are really organizations that are leading the way. In terms of the way we think about school mental health, the idea of not just helping the community, but going into the community, working with the community. I feel like from what I've been reading and what I'm hearing, the Colorado Health Foundation is really working towards, working directly in communities and really being on the front line to move the work forward. So I want to make sure that we're all on the same page with what school mental health is. And, let's see, sorry. So I'm going to begin with what it is not. And here is, my pet peeve when it comes to school mental health. School mental health is not a place where Lucy can go to, set up a little shop. She can be right outside the school, she can be in the school, and she comes in, and schools are a really convenient place because that's where the children are. But if you're gonna come into a school and you're gonna use school time and school space, and you're not working and talking to the teachers, the administrators, and getting a sense of that school, to me, that's not school mental health. For it to be helpful and to get the full impact of it, you really need to integrate and become part of the school community. So what is school mental health? So here is my attempt to describe the many facets of school mental health. It's the first time I'm trying this slide. We'll see if you guys like it. If not, maybe this is the last time I try this slide, but let's give it a try. So we have a group of teachers. In school mental health, one of the things that we do is to work with teachers and make sure they're trained to identify and make referrals related to mental health. And in terms of all the work I've done in schools over the years, my best referral source is always the teachers. They're the ones who often are the first to identify. So we do a training for teachers. They identify, 3 of these teachers noticed that Sally has not been doing as well in school after she had experienced a trauma. She had seen a shooting in her community and is just not functioning the same. We bring in her parents, and in her case also her grandparents who live in the home with them. We talk with them about what's going on and think about what the treatment plan and strategies to help Sally return to her former functioning. We also put her in a group with some peers, a cognitive behavioral intervention for trauma, an evidence-based trauma intervention. She also has benefits from, there's a social emotional learning curriculum that's going on in the school that the school social worker and school psychologists are working together, and they are bringing basic social emotional skills such as problem solving, relaxation into the classroom. They're skills that everyone can benefit from. There's an active group of parents in the school, and they work with the mental health team to help identify areas that they're most concerned about. And they work together to identify those areas, but also to plan, what can the mental health team do to help their children. There's other activities for the entire school, but I want to make sure that people think about, when you're part of a school team, everyone's on that team and everyone needs to be trained. So whether it's the person in the cafeteria, the janitor, or the school secretary, who often has a lot of power, and often they're the ones who see what happens. they're the eyes and ears of the school. You want people to notice if they're seeing a change. Often, mental health concerns begin with a change. It was a sudden change in how a child is doing, and training everyone to notice that's really important. But it's not just in the school building, it's outside the school building. So, what school mental health is when you have a bus driver, think of, that's a pretty hard job, to be driving children with all kinds of, good things, bad things, arguments, things going on, like having the bus driver be available and be trained. There's been some great progress. How many of you have heard of youth mental health first aid? Excellent. A lot of communities are training their bus drivers, and it's had some great impact. We also need to work with our medical community, our doctors, our nurses, to make sure that we're connecting the health and healthcare with the mental health as well. We also have, our business partners. How do you partner? This is your future workforce. So how do you make sure, how do you make sure that your future workforce is prepared for, working in, that they're developing the needs and skills that are required. We also have before and after school programs, our faith-based communities. The point I'm trying to make is there's a lot more that can go on in school mental health across, the multiple tiers of support to help all children. We don't, it's still important to help the children who have the greatest need, but how do you do that in a way where it's integrated, and that you don't have multiple people working with the same student but not working in collaboration? So comprehensive school mental health, what are the key components? We meaningfully partner schools, families, and communities together. We build on existing school programs, services, and strategies. And I think that's important, where you've seen one school mental health system, you've seen one. They should not, it is not a cookie cutter approach. You really need to think, you should be doing some needs assessment, resource mapping, a gaps analysis, what's missing, what needs to improve, what are we doing well, and build your school mental health system around what's working and what's not working and needs to be fixed. It's important to have a full array of tiered services. You don't want to have a system where the only way you can get help is to get worse and to reach the highest end. What can we do? We always say, if you need to help students, you need to help them sooner. We can help them sooner. What can we do? What would benefit all students? And I want to emphasize focusing on all students. Often, how many of you work in special education? How many of you have a lot of paperwork to do in special education? There's a lot of work in general education too, but especially special education, and meeting all the requirements of IEPs, and it's very specific. But how do we make sure we're focusing on all students? One of the things that we know is mental health is equal opportunity. It can, children can be impacted by mental health concerns, whether they're in special ed, whether they're in general education, regardless of their SES, that we need to have a system that even if you're academically functioning well, that you can still get some of the supports that you need. And if you're doing this, this is hard work. If you're going to do this, how do you do this in an effective and efficient way? You have to use what's working. And you have to make sure, are you using evidence-based practices, addressing quality improvement? One of the bravest things you can do if something is not working, sometimes, the word we've used at our center sometimes, strategic abandonment. Like sometimes you have to be willing to let go of some ideas if they're not working, but being willing that sometimes things don't need to continue, but how do you make sure you're working with the whole system? So equity versus equality is something that we very much consider in school mental health. How many of you have seen this cartoon before? I mean, I think it's powerful. You can't give everyone the exact same thing. What may help one child may not help another. And when we do school mental health, we need to figure out what is it that each student needs. When we're working in schools, it's really important that we're using the natural supports. A mental health person, a counselor, they are social workers, psychologists, whoever is part of that team, they should not be working in isolation. It really helps to work with the natural supports in schools, to run groups together, to be in the classroom together, working with your educators, working with your school-based health centers, your school resource officers. How do you build on those natural supports? One of the things that we encourage at our center is really bringing schools and communities together in such a way that the schools don't have to take responsibility for all aspects of mental health on their own, and the community doesn't take full responsibility, but finding the balance. This is just one example. This actually is from Kathy Short. It comes out of Canada. But one of the things we often find is that the school may take more of a role in doing the universal, the targeted prevention, the tiers 1 and tier 2, where the community provider may spend more time doing the clinical interventions than they might in the universal. But what I would encourage, if you want to have an effective team, you need to work on all aspects of the triangle. You need to make sure that you're not leaving people out, because I think if how do you not work in isolation and keep each other informed to have effective care? So why is it so important that we bring mental health into schools? If you look at the median age of onset for mental illness, most illnesses begin while children are school age. So, our autism spectrum, or ADHD, or conduct disorders, oppositional defiant. And if there's anything that we know about mental health, is the earlier you intervene. Even for psychosis, the earlier you intervene, the better outcomes you're likely to have. You don't want to wait for it to get worse to seek support. So how does this translate to a classroom? So let's say you had a classroom of 25 students. Okay. 1 in 5 would experience a mental health problem. And then 1 in 10 might have some severe impairment. But if you look at that, only half will get the services that they need. Now, in my mind, in the classes I've worked with in some urban and rural communities, this would be a pretty good classroom. Sometimes people talk about the triangle being upside down, and you have even greater numbers of students in need. And also some of our classrooms go much higher than 25. Sometimes we're dealing with 40 students and multiple needs and challenges. It can definitely, be quite challenging for everyone. One of the things that we know is people are not great at showing up in outpatient mental health services. When I worked in outpatient care, I really like to be active. I'd like people, if I'm going to do my work, I want people to come. It is not fun to sit there and have someone no-show. No-show rates in the average outpatient clinic are 50%. And people often, the clinics will double, triple book. Certainly some clinics do better, and it's something you have to work on. But the modal number of times that people go to get mental health appointments, what's the modal number? 1. What happens in that first session? Is it brilliance? Often, no, it's paperwork. So, some of it is our systems need to change, so that how do you get people to make sure that when they do go to our community settings, that they come back? We do know that children are more than 8 times more likely to complete mental health treatments in schools than any other setting. So when you are using evidence-based practices, they're more likely to complete and to be successful. So when one of the things that I like about this cartoon is it really brings home, like, why do we need to do this in school? I think sometimes there's a fantasy that if you're coming with mental health concerns or problems that you can kind of check these issues at the door. But you can't. Like, they'll go into the classrooms with you. One kid can have a cute backpack. One kid has multiple suitcases and all kinds of challenges. If we cannot ignore and expect that children can function in the classroom when all of this is going on. In terms of advantages of mental health in the schools, there's a lot more access, but I think we're also, for our families, they don't have to take a child, get them from the school, bring them back to the school. That can take a whole day, especially in rural communities. If the appointment's far away, the student may never come back. And if you're looking at weekly appointments, that's a lot of lost time. It's easier to generalize when you're in the school setting. I can sit in my office and say, okay, we worked on this skill, but working on that skill in the actual classroom is a very different experience. Clinical efficiency and productivity. If a student's not there, get the next student. Obviously someone you have consent and you're allowed to see, but we also can influence who is seen and make sure that we're training teachers not only to refer students with externalizing, that we're also looking for the internalizers, our anxiety and depressed kids who may be wonderful students, but they're not causing problems, but they may still be having significant challenges. School mental health is cost effective. Also, when you're working in schools, there's a greater potential that you can impact the learning environment. It's exciting, working with teachers, working together, bringing mental health and education together to figure out how do we make this successful. In terms of school mental health, this image right here shows that the same student may receive, often people think of the triangle and talk about red zone, yellow zone children. We don't have red zone, yellow zone children. We have different types of interventions and supports. What a student may need in one aspect of their school day may be very different. So the idea that a child who's getting services would also benefit from prevention and promotion and early intervention. If you work at Slides at night, somehow it also all comes down to cupcakes. So maybe I was hungry, but if you think about cupcakes, everyone gets a cupcake, which is good. In my world, I think that's a great thing. But you also can get like some frosting, and some would get a lot more with this beautiful straw. Sometimes I think people think that when we're talking about school mental health that, oh, these are kids who don't have as severe of issues. And I just want to point out, the children who are seen in school often have more intense concerns because they may not have the ability, the support to get them to the community settings. Often these are kids who have a lot of mobility or moving from one place to another, but in terms of what we're seeing in schools, children are coming not with just one of these issues, but multiple issues. I want to emphasize, think about protective factors, not just our risk factors. We don't want to just hear the negative of what's wrong, but what are the strengths of our children, the hope, their social competence, intelligence, what do they do well that will help them be successful, and how do we encourage those skills? So let's not just look for what's going wrong, what's going right. We also have school peer and community factors. This is where it matters what's happening in the classroom. Effective classroom management, high expectations, having clear expectations, having a safe environment, all make a difference for how children are doing. In terms of student well-being, we need to think of not just getting our students to the 0, but how do we get them to the +5? Let's not settle for baseline, let's make it even better. So in terms of mental health and academic outcomes, what we know is when we enhance factors that increase a child's ability to do well in school, and we reduce factors that interfere with their learning, we have success. So school mental health is associated with positive education outcomes, including academic achievement, graduation rates, teacher retention, and that gets to the important part of teacher wellness. School mental health is for school staff too. I'm not sure if you can read it, but it says, I know the kids don't like you and pick on you, but you have to go to school. You're the teacher. You know, we need to think about our, I took a flight here yesterday. You always hear this. If the oxygen mask drops down, put your own mask on first, and then help the person next to you. We need to make sure that we're helping. That if the teachers are not taking care of themselves, they won't have the energy. They won't have what they need to help the students. Now we know that our teachers are stressed. There's a lot of things going on. The biggest ones tend to be testing, concerns about how their students will do, behavioral challenges in students. That's the one I think we hear the most. That's the most popular reason that teachers leave the profession. It's that just dealing with classroom management. Also, I think the other one that we hear the most is the gaps between pre-service training expectation and actual work experiences. Like what I was trained to do sometimes doesn't fit with what I do, and I don't necessarily have the training and support. This wasn't quite what I was expecting. One of the things that's newer in the wellness field is for many years they've talked about compassion fatigue, secondary traumatic stress, and they've usually talked about it in terms of mental health clinicians. Oh, they hear all of the trauma that children are experiencing, it's so challenging. But what we know and is increasingly being acknowledged that any educator who works directly with traumatized children and adolescents is also vulnerable to have compassion fatigue. So, these are all reasons, and our teachers are the ones who are spending the most time with the students. When I look at numbers, I think I include this because I don't know if you can see the citation, but it's my favorite group, my favorite name group. It's the American Federation of Teachers with the group, the Badass Teachers. Anything they want to say, I think it's great. But in terms of what they found is 80% of teachers reported feeling physically and emotionally exhausted at the end of the day. And this has concerned me more. 89% strongly agreed with the statement that they were enthusiastic about their profession when they started, but only 15% actually feel that way now. And just, you may think, well, that's okay, it doesn't come across to the students, but it does. If your teachers are stressed, they're more likely to be sarcastic, respond more negatively to students. And this I thought was amazing when they actually measured the cortisol rates in students. Students who were led by a teacher who was feeling overwhelmed had higher stress levels, the higher cortisol rates, which is remarkable. So we talk about dropout, and everyone talks about youth dropout, and that's a concern. You need to worry about your teachers. When you look at dropout rates, the dropout rate for teachers is actually higher than the dropout rates for students. And these are not people, many of these are people who were planning to stay in the field forever. This was going to be their forever job. What do we do to support our new teachers? What do we do to support our seasoned, all the way around? Like, how do we make sure we're taking care of our teachers? Because we know that consistency for students is incredibly important. Having a caring adult in a youth's life makes a difference. It increases the likelihood that they will be successful. They'll have less behavior problems. They're more likely to finish what they start, to do after-school activities, be engaged in schools. When teachers are coming and going, that doesn't help that continuity. You may not think it matters, but kids who you've had previously and you do that extra hello, it matters. So, when you think about the different components of wellness, there's many different components and areas that we need to think about for wellness. And there's, it's important to consider what are some of the comprehensive school employee wellness program elements. How do we make sure that these elements, so whether it's connecting to employee assistance program, having screening programs, the teachers need a safe, supportive social and physical environment. What do we do to make sure that our teachers are accessing this? And how do we bring some of those wellness lessons to our youth, to our students, to our families? So So one of the things that has been, in our world at the center, but you're seeing it nationally as well, is what do you do for schools? And there's very different theories. Some people, when we look at some of the gun violence and things that have happened in schools, some people want to harden our schools, make them more restrictive. Other people want to do social emotional learning. How do we find the right balance so that we can, let's see, how do I find the right balance so the slide goes to the next one? How do we make sure that we're doing this and we're considering, what is it like for the students? There are definitely students who are scared of some of the drills that are happening, and they aren't necessarily announcing that they are drills, and students are thinking that real events are happening. So how do we better integrate? Is there, you still want to have school security, but what is that right balance where you're protecting the schools but also doing things that we know will help all students? So I want to share some of the resources that we have available through our center. We're part of a national quality initiative with the School-Based Health Alliance. And as part of that, we have a school health assessment and performance evaluation system. It's a free online system to improve school mental health accountability, excellence, and sustainability. And it really offers a lot of there's a lot of free resources. We're not good at making money at the center. We give everything away. So we hope that you'll use it. There's a way to do some mapping to document your needs assessment mapping, document the service array and the multi-tiered systems of support. It really helps to give you strategies and tools for strategic team planning. There's free reports. How do you have a data-driven team process? There's also opportunities for a dashboard to view the landscape of school mental health at the school and district levels. And everyone likes earning stars. Even as you're an adult, you can achieve SHAPE recognition to increase opportunities for federal, state, and local funding just to document the work that you're doing. There's also a trauma-responsive school assessment that's available so you can evaluate your schools. We also have a screening and assessment library that your health and mental health providers can use for free or low-cost screening and assessment measures related to school mental health, and it allows you to filter based on student age, the focus area, really just trying to do your homework for you and pull everything together. We are working at the national level to advance school mental health. We're working with SAMHSA and have a training curriculum that will be coming out this spring, where we will be working nationally with different regions on doing that. We were recently funded with a 5-year continuation of our center, and we will be, as part of that, continuing to improve the SHAPE system and the work that we're doing. We also have our national conference. We will be in Austin this year, and if you're interested in submitting a proposal, the proposal should be coming out next week. I do want to quickly share, we've done a lot of work with SAMHSA and HRSA and our federal partners around mental health, and we did a survey, and we talked about what are some of the challenges, what are some of the opportunities, what do we do next. And the major challenges that this group, these national experts identified, is how do we, are our staff ready? Do they have the time for training? A lot comes down to funding. How do we fund all this? How do we continue to address stigma and health inequities? All the things that we were talking about, but there's also a lot of opportunities. How do we improve access, engage our caregivers, take advantage of, capitalize on some of the policy moments that are occurring, using a whole child approach. Building infrastructure for school mental health can definitely be important so that we can make sure that you're advancing school mental health at the school or district level in a really strategic way. Also, if you work late at night, you think, I'm gonna make this a Wordle. And if you've done a Wordle before, it takes all the words, and the more often the word is used, the larger the word gets. So the national group recommended, where should we focus our school mental health efforts? You can see some of the words that are bolder, so our funding, our trauma, training, resources, engagement, infrastructure, policy. These are all some of the things that we have been talking about. I have some information, as you have a lot of your education and behavioral health leaders here today. I just wanted to share some ideas of what other states have been doing. Some states like Illinois have social emotional learning standards. Think about some of the different areas that you can invest in. Do you want to do universal health and mental health screening? Fund teacher well-being, and look to where the current funding is, because if funding's in opioid work, how do you do prevention? How do you make sure you're bringing substance use prevention into your schools? We also, how do you make mental health a part of the school safety? If you're moving forward school safety initiatives, how do you make sure that wellness and mental health, behavioral health are all a part of it? And this gives you some examples of what other states are doing and how they're trying to use some of that funding and opportunity to build their mental health supports. There's also, some states have done well with providing infrastructure grants to advance the mental health in schools, expand Medicaid, and what I think is exciting is you can think about what else should be funded. Is it like teacher consultation, school team meetings, prevention services? Some states have already done some of this and are doing a fantastic job with piloting and figuring out, how do we fund the wide range of work that we're doing. You don't want to have a system where you're trying to fund the tier 1, tier 2 with tier 3 dollars. How do you have the dollars that you have match the different work that you're doing? And there's always a need for technical assistance and training. So in terms of takeaway messages, Colorado is very much well positioned, is already doing some great work in school health, and has the potential to really continue to lead the way in comprehensive school mental health. Just the idea that you're having a meeting like this today, recognizes that you value this as a topic. I can't emphasize enough, take care of your staff, not only in your school buildings, in your local education agencies, your behavioral health, like how do you take care of the people who are doing the work? How do you use your school and community providers to support that full continuum of care? And education and mental health, sometimes it's hard to work across systems, but we are on the same team, we're working with the same students. How do we make sure we're doing this in a way that maximizes resources? And when you're doing this, you need to use evidence-based practices and strategies. Don't just make guesses on this. You need a system. Don't do screening unless you know what you're going to do if children screen positive. Make sure you have the systems in place. If you're going to have different tiers, fantastic, but how do you know when a child should go up a tier? How do you know when they should go back down and no longer need the support? Make sure you know what you're going to do before you roll it out. And one of the things we definitely encourage, start small. Try this in, if you're trying a new idea, try it with one student. Try it in with a few students, a classroom. You don't have to necessarily make decisions and try something out in an entire district. We've seen amazing accomplishments that have started with just really small tests. So, you all have amazing skills. Appreciate the strengths that you all have. Again, we have a tremendous amount of resources available through the center. Everything I've presented today is available. If people have questions, I'm happy to follow up with you more. But I do encourage you to join our listserv, check out our website, tweet, go on Facebook. Our goal is really, we really want to advance school mental health, but at the end of the day, our goal is really to help all students to be successful and to have the best opportunities that they deserve. Thank you, everyone.
Thank you, Nancy. So we have a few minutes to chat. So I have questions, I think, from wearing 3 different hats.
Only 3?
Only 3 hats. So I have my hat as the foundation president, so I've got some questions for that. I'm an old special ed teacher, so I have some questions from wearing the teacher hat. And then I'm a parent of a child in school, so I have some questions from the parent hat. Okay. All right, so let's start with just the big picture foundation hat. You talked about about 20% of students would have some kind of behavioral health, mental health issue. Is that number rising or declining?
I think it's actually been staying fairly level. When I've seen research, it looks like it's staying about the same. However, that's nationally. So your numbers in your rural communities, some of your lower SES, higher risk urban communities, that number may be a low estimate.
One of the things we've seen more here in Colorado are teen suicides. And from folks, 4th graders through folks in, that it would be in like community colleges or 4-year colleges. What are the data telling us about that? What's precipitating some of that?
I know Dr. Lindsey will talk a little bit, I believe, in his talk about, a lot of it really comes down to stress, the pressures, beyond just the schoolwork, but the day-to-day social aspects of, that are being on 24/7 with technology. There's a lot of things that contribute to students, considering suicide. I think it's important to not be afraid to talk about it. How do we bring the messages to school? I think it's important that it's not only, that we need to put this out there. There used to be some belief that we didn't have to worry about this in elementary school students, that this is a high school problem, this is only a late middle school problem. And I think the trends are indicating that there are younger students who are considering, attempting, and succeeding in completing suicide at sometimes. So, what can we do as a group to make sure that we're talking about it, that we're getting this into schools, that we're addressing it, that we're not afraid to talk about it. And we need to educate our teachers, like how do you identify? But beyond our teachers, I know we'll hear from some youth leaders. It's the youth who can also make a difference. Don't just train your school staff and parents. Often, students are going to talk to other students, and making sure that they have the skills that are necessary to know when to get help and how to get help are all really important.
And so following up on that, from both from the parent and the teacher hat, so locally here in this community, I think it was about a month ago, in the span of 10 days, we had 3 students at 3 different high schools kill themselves. If I'm a district board member, what can I do at the policy level? What should I be doing if I'm the principal at the building level? And what could I be doing as a teacher in the classroom level? And then what should I be doing as a parent at home?
Lots and lots of work to do at all those levels. I think communication, there's lots of resources out there around what can you do when there is a suicide, how do you address it, how do you talk to the students, what do you do for students in the class, what do you do what is the announcement, what are the supports that you have available, and how do you recognize that this occurred but not celebrate it, so that you don't want a contagion effect where students think that this is a good option. But I think parents, teachers have to take this seriously, have to look for signs and symptoms, and students need to know that there are safe places that they can talk to people. One of the things that I think is really important, that I think has gone well with reducing stigma, is that we have our clinicians working with the whole school. So if I come to see, if I'm in your office, you don't know, you could be in a leadership group that I have. You could be in this special enrichment activity that we're doing, versus the only students who go to see Dr. Lever are having these major concerns. So how do you normalize this? How do you talk about it when there's conflicts? how do you address them? And it cannot be, kids will just be kids, and this is typical. How do you take some of the bullying, some of the challenges that are occurring, how do you take it seriously? And how do you work as a team to best address it so that your school is a safe and supportive learning environment?
Over the last couple of years, I've probably talked directly with 250, 300 children who are fourth grade through college. And I asked them all, do you know someone who either attempted or succeeded in hurting themselves? And every child or young adult has raised their hand. And then I asked them, and then I'll talk to them about it, and they'll say, well, we knew she was having trouble, or I was the one who actually tried to hurt myself. And I would say, well, did you ever tell your parents? And they immediately, I'll say, oh, no, we'd never tell our parents. And I say, why wouldn't you tell your parents? And they go from well, it would just be weird. It would just be weird to talk to my dad about that. To the other extreme where a young lady said, because then my mom would find a way to make it my fault. What were you doing that they were treating you that way? So I just wouldn't talk to them. And so how do we then help them find that trusted adult if it's not their parent or whoever is the adult caregiver in their life?
I think often the trusted adult is not going to come from an assembly saying, hi, I'm the trusted adult. It's going to be from what they're doing all year round, their interactions, that they know this is a person I can talk to. She cares, he cares. So I do think there's plenty of opportunities, whether it's through activities, whether it's through the classroom, where they can figure it out. But I do think it's important to let students know that and for teachers to let students know, for administrators to let students know that there are opportunities in people that they can talk to when they need it. But also that's why I think it's so important for, not to have it on the responsibility of the student that they have to be the one to ask for help or to know that they need it. That's why it's important to also have all that training around mental health identification and referral. When do you know there's a problem? How do you help someone who's having a concern? So that between, you have a lot of people who are trained to recognize signs and symptoms. And sometimes it can be very obvious, and sometimes it's not, that a student is struggling. I mean, often you'll hear, I had no idea, they seem like they had it all. How do we look for some of those clues, take them seriously? But I definitely love having other adult mentors, supports. I don't want to give up on the families. As a clinician, sometimes I would work with students and I maybe spent a little bit too much time with them and needed a grown-up conversation here and there. But it would be, like, you would hear these stories about, it sounded like an ogre. Like, you wouldn't believe how awful and terrible the parent was, but when you would actually meet them, how do you, I think there's maybe the parent is somewhere between what the child describes and what's really going on. How do you still figure out what to do with the parents? How do we try and encourage positive interactions? How do you bring students and their families together in really good interactions with one another, so when you need, when those challenging times happen, you have those really firm relationships that have been developed. So I do think it's something that you have to keep working on.
What's the role of social media in creation of some of the issues, and where might it help be part of the solution?
Fantastic.
That's a small question.
Yeah, fantastic question. We have, I think social media is, can be great in terms of sending messages, like healthy messages. You can be very strategic about what messages you want to get out to youth, to families, to school staff, and it can be a very positive thing if you have to realize how to best use it. But I also see youth who are devastated by some of the things that happen on social media, and they can post something and they're really upset. It's hard to counsel a student, like, what are you upset about? I posted something and I only got 10 likes. That's terrible. It's really embarrassing. It's like, really? but it matters to students, and it's also the haves and have not, like who has the technology, who doesn't have the technology. You know, you can put something up innocently and then it could be used in another way. So, you know, certainly social media can be a fantastic thing. We're connecting kids, helping them, you know, find a group that they fit in with, but it also can encourage some negativity. We also have media in general where, you know, I want celebrations of when youth are doing fantastic things and the same level of excitement and the news media coming to cover, like, you know, this student traumatic event or bad things happen, sometimes that gets a lot more press.
Okay, now let me put on my teacher hat. Okay. So this all sounds great. And you had the bad model of just the psychologist that comes in and is there and it's their job. We don't even have that. How am I supposed to? I'm trained in pedagogy. I'm not a trained social worker. I'm not a trained mental health professional. Nor do I have the time, nor the encouragement, or am I rewarded for this other? How do I do this in the course of a day, my regular day?
And I think the answer to that is your reward is if we can work to address these mental health concerns and work on classroom management of the mental health concerns. So it's not necessarily classroom management from an education perspective, it's classroom management related to mental health concerns like ADHD, depression, anxiety, and so forth. If we can manage those and help you build a system that fits your education style and we work together, you will gain back teaching time, which is why you went in to this in the first place. You're not, you know, no one says, what I really want out of teaching is I want to manage classrooms. I want to manage behaviors. Has anyone said that? No, I don't think so. But, you know, how do we find that balance? Or like, to me, that would be the sell. Like, if you do this, you could potentially gain back your precious teaching time and save the time that you're spending, you know, just getting really frustrated.
And tell me what the this is on a daily basis. What would I be doing more of, less of, or doing differently on a daily basis in my classroom and with my colleagues?
In your classroom, maybe it's more, you know, positive reinforcement, ignoring some of the behaviors. Maybe it's, you know, it could be as simple as a behavior chart. It could be, sometimes it's understanding. If you have that different perspective, instead of Johnny just being a really, you know, difficult, challenging student, that he's actually going through some of this and what would be helpful, and, you know, just having some insight into it. I don't think there's any one answers, but it's figuring out, you know, what are the accommodations that student needs. What could you do? What can that student do in your classroom that could keep them from having an outburst that could, you know, disrupt your class for 20 minutes? What can we do to help them? What is a strategy? Now, I'm not a big fan of the strategy shouldn't be we'll send him or her to the office. You know, what can we do? And the more we can keep students in class and learning, but I do like the idea of working in collaboration, figuring out what are the best mental health strategies. Again, what are the best education strategies? I do think, you know, the best, you know, forget about some of my teachers who taught me clinical psychology. If you want to know how to manage a group, watch that educator, that seasoned educator who can, that same group that was causing havoc in one class, and, you know, that teacher has control. Like, what are those skills? What will help, you know, bring order and structure? You know, what are the behavior management strategies? But I do think the strategies need to be specific to different mental health concerns. Minnesota developed a resource that I really liked and talked about accommodations for different mental health concerns. That's something I can share. So, like, what are some of the adaptations in the classroom for the ADHD student with ADHD concerns? What do you do with a student who's depressed to help them be more successful?
And so now for the parent. So I do actually have a child who suffers from anxiety and depression. And he is not the classroom disruptor. He's the quiet one. He is following every rule, but he's still there suffering. So again, that's another set of strategies. But now as a parent, I work, and my school has started this new integrated program that involves the family, but I'm supposed to go once a week to a meeting at 3 o'clock to meet with the team. I'm working. And if I don't work, I don't get paid. But if I don't show up, I'm seen as a non-involved parent. What am I supposed to do?
I think everyone has to come up with strategies that are going to fit the family and figure out, like, okay, maybe you can't come in. Could you come in once a month? Can we use telehealth? Can we FaceTime with one another so at least we're seeing one another? What are some of the creative strategies that we can use? I definitely think, most mental health providers are really happy to work with parents and want to engage parents. And, we have to meet parents where they are and recognize that they may not have the time, that their job could be in jeopardy if they miss this. And also, if their child is always in trouble, then they may not want to, oh gosh, you're going to have me come to the school, you're just going to tell me again that I failed, that I'm not a good parent. So what do we do so that it's a win-win for the parent? But it can't just be based on what my schedule is, what works for you, and how do we make that work so you don't lose your job, or that this is a good experience for you too.
Last question, sorry. So again, for my son, especially when he was younger, he was in a pull-out program for speech therapy. He was in a pull-out program for the counselor. He was getting pulled out for special ed, like language. And there was no one integrating it for him. It was all left for the child to manage, and it buckled him. So in the model you described, who is navigating and coordinating on behalf of the child?
I don't think it's any one person, but there should be someone on that team, like whether it's a mental health team, a student support team, whatever you're going to refer to that team as. But I do think it does help if someone is sort of in charge of it takes that more individual experience. But I definitely do not think that should ever be the responsibility of the child. It's hard enough as an adult to take some of that on. Mm-hmm. But I also think, how do we make it so everything is not pull out? We'll pull out for this, we'll pull out for that. How about we push into the class? Mm-hmm. And how do we, bring the resources and supports into the classroom in a way that's going to support the student, but also not interfere with the education process?
It's a great ending. Thank you, Nancy. Everyone thank her, please. I think put it back up there. Next up, we're going to have to bring up a few more chairs to do the next panel discussion, which will be moderated by Hillary Fulton, who's a senior program officer at the foundation. And I think next month, Hillary will be celebrating her 15th anniversary at the foundation. So we're delighted to have her do this. She is very active in our healthy schools work and in our behavioral health arena for teens and young adults. So Hillary and all
right, everyone, we're going to take just a few minutes to get set up, but this is not a real break. It's a stand up, stretch, get coffee if you need it, sharpen your pencil. We're going to start in just a couple minutes.
Can we trust you with such a thing?
Probably not.
See that sparkling guy. Trust you? All right.
Have you heard from him?
He's in traffic. But he was going to be here about 45 minutes ago, so maybe he left late.
Yeah. And Rachel texted me and said, well, I know he's on his way. I said, well, I thought that an hour and a half ago, so we'll see. So I hope he'll be, you know, I was going to say a surprise guest, but it would be a surprise if he wasn't a guest. Okay, can you all see each other? Yeah. Does anybody want to donate water?
Remember, this is not a break. What are you doing? We're just getting started. It's wonderful to see so many faces here today, many of whom I have known for years, and also many who are new. I know there are a lot of school leaders who are here today, so I want to thank you especially for taking the time away for the conversation. And I am really thrilled to be helping to moderate today's discussion about involving youth in conversations about behavioral health in our classrooms. So just briefly, we have today Sasha Miller, who is a sophomore at Erie High School and part of Colorado's Youth Advisory Council. We have Hero Dahlman, who is a senior, and she is part of Brighton's Youth Commission. And then we're also joined by Scott Lowe Murray, who is the Deputy Director of Sources of Strength. Finally, we have Andrew Romanoff, who's the President and CEO of Mental Health Colorado. So we have two young people who are living and breathing the importance of youth leadership in these conversations, and two old people who really wish they were younger and could do that, but instead they are striving to be allies for young people in schools. So I want to get started, first of all, with Sasha and Hero. And I'd love for you to spend just a couple of minutes telling us about the leadership roles that you're in. If you could share a little bit about the commission and the council. And then what inspired you to participate in that?
My name is Sasha Miller. I am our youth mental health chair on COYAC. So COYAC is the Colorado Youth Advisory Council, which is a council run through the state legislature, in which we create committees and write proposals for the legislators in the year. And I think our current groups this year are substance abuse, higher education, K through 12 education, and youth mental health. Youth mental health has been a subject on the committee since it was started in 2008 and has had its own subcommittee for the past 8 years. Every single COYAC applicant, which comes from every single Senate district in the state, has marked mental health as a concern on their application. And so we've decided it's a very big concern that we're wanting to get involved in.
My name is Hiro Dahlman. I'm on the Brighton Youth Commission. And the Brighton Youth Commission is a youth-led, youth-driven organization made up of 22 youth and 6 adults. And our main goal is to give youth a voice in our community. We do things such as our Speak Week, which is our most popular and biggest project. It's a suicide prevention program that we implement in our schools, and it ends with a 5K walk for our whole community. And we do a bunch of other things like volunteering for the community, and we're also really close to City Council, so we do a lot of stuff for them too.
So what was it for each of you that inspired you to kind of put in your names for the roles that you're in?
I didn't know a lot about the Youth Commission when I applied. My dad was just like, you should join this. And I was like, okay. And so I went to interviews, and it's kind of like a group interview, so we kind of like went around and had fun and whatever, while also asking us a bunch of questions. And that's it was during interviews, which is where I figured out what the Brighton Youth Commission actually was. And then, afterwards I was really, really hoping that I got on it, and I did. So, and I've been there for 4 years now, so yeah.
That's great. Sometimes dads are right. Sometimes. Okay. What about you, Sasha?
For me, I applied to COYAC as a 8th grader, and then was accepted into the program halfway through my 8th grade year. And originally, I'm a very introverted, kind of very shy person, and so joining COYAC, I wanted to get more involved in my community and more in leadership and build those skills to talk to people. And then I wanted to get more when I joined COYAC, I knew there was other committees, there was focuses, but I didn't know that much about any of them. And so I was kind of drawn into the Youth Mental Health Committee by a project we were doing in which we created a proposal which asked the state legislature to direct some funding towards the Office of Suicide Prevention. And through that, the group that was doing that got a grant for a prototype of a website that's teen-based mental health resources and suicide prevention, which is currently still in the prototype stage. And they got a really big grant for that, which was great. And also, mental health is kind of I don't want to say sore subject, but it's kind of a very important subject in my life because it has affected my life and a lot of my friends and family. And so that's why I decided to get involved.
Thank you. So moving over to Scott, I just learned that Scott rearranged his day today, so placing his final in his life for this afternoon. So we're really thrilled that he put that off, procrastinated one last time to be here. And Scott, as I shared, is with Sources of Strength, and I'm hoping you can tell us a little bit about the program so we have a feel for your work, and also share kind of how it came to be.
Yeah, absolutely. Final of grad school this afternoon, so graduate on Saturday, depending on how this afternoon goes, I guess. So Sources of Strength, it was actually started by my dad, and so the face of nepotism up here. We've got a bit of an atypical father-son business, but really the the genesis and development of it was going around and doing a lot of work and just seeing that so much of what we typically consider suicide prevention was really at its root intervention, right? Identifying people who are already in crisis and trying to get them to the proper mental health referral, and everything felt very reactionary and very crisis driven, and really we had a strong sense that we could do more to get ahead of this, that we could look further upstream and really asking what would it look like to build resiliency in people's lives, to shift some of these norms around help seeking or codes of secrecy and silence, to increase protective factors, to increase connectedness, to increase trust towards adults, these types of things, and really asking, how do we get ahead of this issue? How do we actually build healthy individuals and healthy communities, and really have a preventative impact? And then really looking at some of the gaps that we were seeing in the field, and shifting from kind of a risk-focused strategy to a strength-focused strategy, and shifting some of the messaging strategies to be more focused on hope and help and strength and the true norm that most people get better, and we need to really tell those stories and talk about how we do that and what that looks like. And then also we were seeing a lot of teen suicide prevention without any teenagers. And we felt pretty strongly that, man, if we're going to make an impact in high schools, we got to have high school students involved. So really trying to shift fill some of the gaps that we were seeing in the field, but really then move some of the work of suicide prevention further upstream, and then really kind of our scope and our focus has really evolved from just kind of suicide prevention to really much more mental health promotion and how it has these kind of more universal preventative outcomes.
Thank you for the overview. And Andrew, would love to hear more from you about your recent school mental health toolkit, how that came to be. And we'll just start with that as a grounding place.
Sure. So my name's Andrew Romanoff. I used to run the House of Representatives in Colorado. Now I run a mental health organization. You can supply your own punchline at this point. People often ask me, what's the difference between running the State House and running a mental health group? The difference is mental illness is treatable. The more you learn, the more upstream you decide to go, as Dr. Lever was saying. So a couple years ago, we engaged at Mental Health Colorado a conversation with students and teachers, parents, principals, superintendents, school board members across the state, asking them what barriers they were encountering in trying to improve the well-being of their kids. How do you, as Dr. Lever was asking, screen kids for mental health concerns? How do you embed social and emotional learning in a school's culture and curriculum and budget? How do you deploy more mental health professionals in the building where kids are far more likely to get the care they need than if it's available only off-site? How do you engage parents and families in that conversation? How do you pay for all that? Because we know it doesn't do much good to tell schools what to do if you can't explain how to fund it. So we spent a couple years engaging in that conversation, researching best practices across the country, and then building a school mental health toolkit. I know we're forbidden to use PowerPoints in this discussion, so I brought a prop instead, but you can find it online at mentalhealthcolorado.org/school toolkit. It lays out 10 evidence-based practices along with funding strategies. We just got a grant from the outgoing Attorney General of Colorado, Cynthia Kaufman, to try to bring these strategies to the benefit of all 178 school districts in the state. So we're pretty excited about that. And I should also just say, we've been engaging a lot of the folks on this stage. So Sources of Strength is one of the evidence-based programs that we highlight and hyperlink in this toolkit. The Brighton Youth Commission is one of the groups we honored as Organization of the Year at our gala a couple years ago. And the Colorado Youth Advisory Council is a group that we've engaged in trying to shape policy decisions at the state legislature, because we know from our conversations with stakeholders that sometimes there are statutory or regulatory or certainly budgetary obstacles in the way of doing what the evidence tells us we need to do.
Thank you. All right. So I want to turn back again to Sasha and Hero, and I want all of you to take out your paper and your pens or your computer, because this is, I think, probably, at least for me, when I have the opportunity to sit down with young people, one of the most important conversations, and that is how can adults make way for more youth engagement in schools? And if you can, either through your personal experiences or through that of your peers, what are some things that have worked really well to do just that?
From my time in Koyak, I've been on the council for about 2 years now. I figured out that it's, as a youth in policy making decisions and working more closely with the Capitol than a lot of youth, it's really hard to get adults to listen to you or people in power to listen to you, because we can only do so much as youth. But really my biggest thing with adults listening to youth trying to make a change is like listen to our ideas and take in consideration them, but then also educate us, say, we want a budget expansion for mental health. Wait, that's not possible, there's no money there. Then tell us that so that we can make new ideas or new ideas about that and take that into consideration.
So the city of Brighton is actually really supportive of the youth and really engaging. So city council comes to us all the time and asks us for stuff. So for example, I was on the interview panel for the city manager of Brighton. So yeah, adults are really supportive, and even adults outside of like city council and stuff really appreciate the youth commission. In order to get students more involved with like adults in schools, I think you just need to like ask around, and I'm sure students would, love to join. It's more about being equal to each other. So instead of like the adult being the leader and doing all the ideas and everything, and just like kind of asking for input from youth, it's more of like you are working together with youth almost as equals. So that's what I think.
Adding on to what I said, it's great if like input is taken from like a variety of sources. Like you don't just ask one student, or you don't just ask like a classroom. It's good if like say there's some people from rural areas and some people from urban, and they're both weighted completely equally or as they are.
Just tell you a quick story about the power of youth testimony. When I was in the legislature, I sponsored a bill, a state version of the McKinney-Vento Act, that would allow a kid to stay in the same school, even if homelessness had forced her to move from one shelter to another across districts. We had a young woman come and testify in a legislative committee, a pretty daunting task with a bunch of lawmakers assembled on high, staring down at her. And she said very poignantly and powerfully and persuasively, the only thing that stayed the same in my life are my classmates and my teacher. I don't know where I'm going to live next week. My family doesn't have the same place to go to sleep every night. Can you please make it possible for me to keep my classmates and the teacher that I like instead of making me move to another school? You could have heard a pin drop in that room. Her testimony, more than all the evidence we assembled, more than all the lobbyists we marshaled, more than all the debate that the legislators brought to that bill, her testimony is what turned that bill into a law. So if there are kids listening online, or certainly leaders in these coalitions, I hope you'll tell the adults who are making these decisions what to do, because the truth is you're going to live with the consequences of these decisions a lot longer than the rest of us, than the old folks like Scott and me.
So Scott, I know your role is kind of right in this bridging place between connecting young people and adults and forming those strong relationships in schools. How have you seen, whether it's through sources of strength or in other ways, technical support or training for adults to prepare them to engage differently with young people?
Yeah, I mean, I think it's a lot comes down to relationships, right? It really comes down to working with adults and students in partnership and together, and realizing that one without the other, we're really going to lack impact and we're going to lack power, and so fostering that partnership, fostering that connection. So I think sometimes it's providing a bit of a reframe for adults and helping them see the need and the necessity of bringing youth voices in. That I don't know if you've noticed, but adults are not great at shifting teen culture. But the students are. It's what they do. And so if we're gonna shift norms in the school, if we're gonna shift help-seeking behavior, if we're going to increase healthy coping strategies, if we're going to shift the norms and the behaviors and the attitudes and the beliefs, we are not going to be successful if we do not bring student voices into it, that their voice are the voices of influence, and they can be these agents of change. And that really largely adults' role is to help support and facilitate that process. And so then I think sometimes it's, there's some practical things around, food helps, and recognizing peer leadership and their contribution and honoring that and recognizing that helps with retention. Having fun makes a big difference. Accomplishing goals makes a big difference. If it's just food and games, students are going to be like, I thought we were actually doing something here, and they're gonna peace out. And so incorporating all of these kinds of elements to keep students involved. And then I think it's also really important to recognize that there's a need and a necessity, I think, for scaffolding supports. That's probably the adult support that's needed in the Brighton Youth Commission or COYAC is probably at a lower level because of the level of leadership of these students that are involved in those initiatives. Whereas some schools, there might be a lot more guidance and structure that's needed to be provided by the adults to really help build that leadership and create that foundation. And I think sometimes adults need to feel some of that freedom as well. And I think what we've recognized in a lot of our work is that there can be freedom within structure, that there's a roadmap and there's some framework and some guidelines and some resources to facilitate those student ideas and to really help those students thrive and setting them up for success in those leadership strategies. And so I think a lot of it is some conversation and knowing your students and knowing your group and kind of knowing the purposes of some of what we're doing.
So you have referenced a couple of times the importance of changing norms, and you've named a couple of them, but I wondered if you could spend a little more time calling attention to common norms in schools that are not supportive of kind of promoting strengths among young people related to mental health, and then what is the kind of path to changing that culture? Sure.
I think sometimes there's, some of the things that we have an evidence base in and that we're really trying to shift, that we've been able to see is a shift in perceptions of adult support. So that if I go get an adult involved, they're just going to complicate things, and being able to shift that to an adult could actually be helpful, or asking for help is a sign of weakness. Actually asking for help is a sign of strength and courage. To getting help for a friend, I'm being a snitch. To getting help for a friend, I'm being a good friend. When that starts to become the culture and the norm of the school, a lot more people are getting connected to help, and we're able to shift those things, as well as leaning into our strengths, as well as seeing, having a sense of hope and vision that our friend can get better, or that we can get better, that these issues are treatable. And I think that, honestly, in this field, I think is a really important conversation. The way we talk about these issues really matters. And what tends to happen is we throw out a lot of statistics or a lot of sad images or a lot of shocking stories. And often with our most vulnerable students who are themselves really feeling hopeless, that they hear that shocking statistic, they hear that traumatic story, they see that sad image, and they say that, yeah, that's me. And it reinforces a sense of inevitability and hopelessness in their life. And really, I think we need to create that counter narrative, that we throw out all these statistics about suicide deaths, and these are accurate statistics, and they're important to discuss from a policy perspective, but from a prevention perspective, from a public health perspective, they can often have the unintended consequence of creating a false normalization effect, making it seem more common than it truly is. And the truth is, the vast majority of people who struggle with feeling suicidal do not go on to die by suicide. Recovery and resiliency are the true norm, but that's often not what's communicated. And so I think a lot of times it's helping create that counter narrative of hope, of help, of strength, of connection, of trust. And the students are really integral in being a part of that, and in drawing people into that conversation. And I think that's one of the other things that we've really learned, is that when you can move somebody from just being an audience member to seeing your poster or hearing your presentation to being a participant, where they're actually interacting and engaging with what these strengths look like in their own lives, with what trusted adult they would go to, and writing them a note and going and saying, hey, I named you as somebody I would go to, that breaks the ice, makes it far more likely that they'll actually go and talk to that person. And so when students can be facilitating those conversations and those interactions with their friends, that's where we really start to see that permeation happen across a population, as well as moving from not just attitude change or knowledge change, but actually behavior change and the way that we respond and interact and confront the adversities of life with strength and with resiliency. And so I think that's a lot of what we're seeing happening.
So Sasha and Hiro, you are experts in mental health, and you're experts in going to high school. And I would love to hear from those perspectives what you see as some of the greatest opportunities to improve kind of the culture in your schools related to mental health.
So I come from a smaller town, which is Erie, which is kind of down below Boulder and Longmont. And personally in Erie, we might have 9 dentist offices in our small town, but we have nothing for mental health. So we can't go anywhere in our town for mental health, and we have no bus system. We have one bus that goes to Boulder and back that runs twice a day. So we don't really have that access to get help if we need it. Our school is we've suffered a couple suicides in recent years, which has been really hard on our small town community, and we've kind of bonded together because of those suicides and tried to start new programs and new things. We recently had Sources of Strength started our school, and things like those to help bond us together. But I think the biggest thing that we really need to take in to account for students is accessibility, because that accessibility could have saved some of the students' lives.
I'd say that the biggest thing that we need to change is the language in schools. So I don't know about if teachers know or if Sasha knows, but at my school, a lot of people say, I want to kill myself after oh my God, this final was so hard, I want to kill myself. So that language is all over the place, and so many people say it. And I think it just makes it so that if anybody actually does feel that way, they don't care because it's just part of the norm. So we actually suffered a suicide recently, like a couple months ago. And that could be because of that. It could be because, a bunch of bullying or feeling like they couldn't talk to people, but definitely that language of, I want to kill myself or whatever is definitely a problem.
And I think a lot of teachers and students, if a kid comes up and goes, oh, I want to kill myself, or I'm depressed, or something like that, they don't know how to deal with it. Because if somebody comes up to you and says that big sentence and it's like, what do I do? I know I have a friend who he was depressed for a while, and he came up to me and said, hey, I need your help. This is how I'm feeling, and that kind of thing. And when we reach out to resources like Safe to Tell or parents, those kind of things, Safe to Tell, if you call it, they just send a policeman to your house. And then that can get in trouble with your parents, with people, your guardians, those kind of things. From every experience I've had with Safe to Tell, it's always sent police to their house, no matter what, which isn't ideal in a lot of situations. And so I think that just knowing how to deal with that with both yourself and your peers and your teachers is a great opportunity.
So Sasha said that a lot of teachers and people don't know how to deal with it when someone actually does come up and say they're depressed or whatever. And I actually have firsthand experience in that. So I told a teacher that I had major depressive disorder, and they sort of just okay, and left. So, I think training teachers to kind of know how to deal with that sort of situation is really important, whether it's to give advice or just to listen. I think it's really important.
Thank you both for reflecting on that. And feel free to grab the mic again if you come up with another idea. Andrew, I would love to hear more about kind of your process in the development of the toolkit and how youth leadership or engagement kind of comes through there. And if you have some examples of districts or schools that you've encountered that are doing good work in that area, we'd love to hear that too.
Sure, and some of this I think will echo what Dr. Lever was saying earlier. What we're talking about here is getting every kid, not just the 20% at risk of developing a mental health disorder, but 100% the benefit of social and emotional learning. So how do you teach compassion and empathy? How do you help kids resolve conflicts more peacefully? How do you help them become more resilient and teach coping skills? Those are some of the things we learned from the research we did and the conversations we had with students and others. And how do you address, again, as Dr. Lever said, the mental health of teachers and train not just the faculty, but cafeteria workers and coaches and bus drivers and others to recognize some of these early warning signs, because it turns out, as I'm sure you'll hear from our students here, that a lot of students might be more comfortable talking to somebody other than a teacher, and making sure everybody has programs like Youth Mental Health First Aid or recognizes some of these signs, and better yet, has somebody at school on site to whom they can be referred if they are developing these concerns. One of the, I think, most alarming facts we came across in the course of our research suggested that for Colorado to meet national recommended ratios in terms of the number of mental health professionals per school, we would require twice as many school nurses, counselors, and psychologists, and roughly 9 times as many school social workers as we have right now. There's clearly a cost to making those investments, I would argue, and the evidence would suggest there's a bigger cost not to. So we are working with the state legislature and hope to engage a lot of youth allies in this push to get more funding into the programs like the School Mental Health Professional Grant Program, which makes at least short-term grants available. But the real struggle, I think, for a lot of schools that are trying to make these strategies is how do you create sustainable revenue sources instead of just one-off grant programs where the dollars expire and the intervention runs out. There is some good news on that front, I will tell you. Just last month, the voters across the state invested in mental health in 10 different communities, including Denver and Larimer, Summit and San Miguel. Half a dozen other places, including school districts, said, will you pay for mental health? And in 10 of those 11 initiatives that were on the ballot last month, the voters said yes. Obviously, that doesn't do you much good if you're in a district that is too low income without the revenue base to support these investments. One of the pushes we'd like to make at Mental Health Colorado in conjunction with some of the groups on this stage is a state-local partnership. I had the privilege in my last year in the legislature of sponsoring a bill called BEST. It stands for Building Excellent Schools Today. We named it BEST because we thought it would be really hard to vote against. Nobody's going to be against the BEST bill. And almost nobody was. The bill passed by a margin of roughly 99-1, or 99 to Bruce, as we like to say in honor of Representative Doug Bruce at the time. But the reason we passed that legislation is because we knew that the safety of schools was literally a life or death concern for a lot of the kids and the staff who were trying to work there. I'd argue that the mental health needs are just as literally a life and death concern. So we ought to be able to take the same priority to this issue as we did to that. And by the way, that program resulted in about $1 billion in school construction, the largest investment in that field in the history of Colorado, that enabled us to build or rebuild a couple hundred schools across the state. We could make the same commitment here with bipartisan support.
So, did you have something you wanted to add?
I was just out of habit grabbing the microphone.
So we have talked a little bit today already about issues surrounding a sense of safety in schools. We've also talked about building social, emotional, or coping skills. And Hiro and Sasha, I'm interested in both your experience of school as a place that feels safe or not, and why. And also, can you tell adults are trying to help build your coping skills? And how's it going?
So recently we had a lockout where someone brought a gun to school, and like the adults were really awesome because they responded super quickly. They caught him outside, I think, so like they just called everyone inside and everyone just hung out in their classrooms and the situation was taken care of. And we have a Taco Bell right next to our school, which gets robbed like every other week. So the fact that it never like comes to our school is really awesome because it means that, you know, the police and the school staff are making sure that we're safe from all of those things happening. So in that regard, I think the adults are really doing a good job with giving kids like mechanisms for, you know, that sort of thing and making students feel safe. In regards to like mental health, I'd say we still have a lot to do in that.
Yeah. Kind of building off Hero, Erie is a smaller town, and in my school, all of our teachers are great when it comes to safety procedures like that. They know what they're doing, where they're supposed to go. We do it every month at least for every one of the drills. And so they really know how to deal with emergencies in that kind of way. But when it comes to mental health, it's kind of where we lack. Like I was saying earlier, like when somebody comes up to you and tells you, hey, I need help, they don't know how to help, and we don't necessarily have the resources to help. Erie is about 1,500 kids now, and we have 4 counselors. So if, say, the statistics that were said earlier, say 1 in 10 have serious impairments, that's about, I don't know, math. Like, let's say 30 kids per counselor, which is on the low side, who have serious impairments and have to meet however much on top of all the scheduling things they're in charge of, on top of, I'm sure many of you who are counselors can attest to this, on how busy you are, how much paperwork you have to do, how many things you have to keep in mind. And so I think that education for both the students and the teachers, like resources, can help that.
I just add a piece about the resources, because I know you could be forgiven if you're running a school or teaching in a school for thinking that we're asking you as a school to pick up the tab and the responsibility for everything else that society is shortchanged. It's the focus of this conversation, but it wasn't the focus of the actual the plugged symposium, right? So I just want to make a pitch for the rest of the equation here. We're developing a toolkit around early childhood, because we know that even though the signs of mental illness may be appearing during adolescence, the causes are taking shape at an earlier age. We want to be able to answer the question, what can you do as a pediatrician, a parent, a child care provider, somebody in the business, in other words, of serving kids between birth and 5? How do you mitigate the effects of adverse childhood experiences? How do you build social and emotional development among our youngest kids? We'll make that toolkit available for free online. We have the same bad business model, I think, as Dr. Lever's organization. And we're trying to answer the same questions for cities and counties. So what does Erie do? What does Weld County do? How do you make a community mentally healthier? How do you add mental health professionals to police and sheriffs so when they ride along in response to a call, there's somebody who can effectively defuse a situation? How do you make mental health part of an overall public health strategy? How do you pay for all of that? How do you hold insurance companies accountable for providing equal coverage for mental health and physical care as they're required to do by law? We don't want to just simply saddle schools with the responsibility for everything else that we as a society need to take ownership for.
Yeah, kind of adding on to that, during our research in Koyak, we found out that early education for mental health and preventative services is really, really important, and can it'll help with not having to do so much intervention or so much preventative work later on, because if we teach the kids resiliency and learning to cope and those kind of things at age 5, it's a lot easier to learn stuff at age 5 than at age 15.
Can I just poll the audience real quick? A reflection of the conversation we had earlier. How many folks are in schools where you screen the kids every year for vision loss, for vision problems, for hearing, for mental health? So there's one district. Where are you? Right. It's just telling, I think, that we're not addressing this at a universal level. And maybe it's because we don't have enough time in the school day, money in the school budget, mental health professionals to conduct the screening. Or maybe it's because we fear if we screen kids and identify the 20% in need and we can't address the problems that screening detects, we might be out of luck or even worse, liable for our failure to solve a problem that we just found out about. We got to figure out a way to address that issue as well.
So I definitely think that addressing it early on is really important. and trying to figure out, if they are mentally healthy and giving them the resources early on. But I also think that you shouldn't necessarily diagnose someone with mental illness before 18 unless it's for sure, because the brain being what it is, if you tell someone that they're depressed and they're not, will soon develop depression because it's what they think they have. So also like addressing that early on and saying like, you exhibit these behaviors, so let's try and find something to help that and not necessarily like diagnose it right away.
I think that's an important point, and again, why with Source of Strength we take this strength-based approach, and I think often we approach this conversation through sort of a deficit model of what are your risk factors, what do you lack, what are the things that put you kind of in this category, and really we can focus on like what are your strengths, what are your protective factors, what assets do you have. Who are those people, what are those things, and help, again, it's helping build that protective factor framework, it's helping build those coping strategies, it's helping build resiliency. And I think to your point too, it's that we're learning more and more, every month about positive psychology and that the lens through which our brain is processing the world is really shaping our reality to a large part, and so the way we talk about it really matters, the way we think about it really matters. If we're thinking about it through this lens of chronicity, that I have this thing and it's who I am and it will always be that way, rather than through a lens of here are things that can help me get through this, and here are things that can help me live with this in a really healthy way, and we can see that modeled for us in other places where we can find hope and find mentors in that. I think the lens we use and the language we use really matters in helping people and helping young people and adults really navigate that adversity in our life, and really see, not getting that tunnel vision where that hopelessness begins to seep in, but really see that light at the end of the tunnel, that we can get better and we can get through that, and we do have assets and tools and resources at our disposal to help facilitate that process.
All right, we are closing in, and I would love to invite each of you to share kind of one last thought with the group. You can pick really anything you want, because what am I going to do? Kick you off the panel. But pick, is it something that you want to make sure that this audience knows that they may not know? Or do you have one bold recommendation that if somebody in one of these chairs could pick up and take on would make a huge difference? What would that one thing be?
So personally, I think that involving youth in like decision making and policy making is really important, and youth really want to actually do that. And I'd also say that understanding that depression is not something that's the same for everyone. So how I react and how I think with depression is going to be different from someone else, which makes it really complicated and complex. With mental illness, I think, I don't know about every mental illness out there, but just learning all you can, I think, is really important.
I think leaving off, I just want to leave you all with knowing the youth want to recover. The youth with the mental illness want to recover. They don't want to stay like this forever. It doesn't feel good. They want to get better. They just either don't have the help, don't know where to get the help, those kind of things. And it's important that we make those available for them, because we can't keep losing students to it.
At the risk of being poetic, there's a proverb that says, a society grows great when its elders plant trees whose shade they shall never enjoy. And I just think we have to have a bigger picture for what we're doing in this field and in this space. We need to invest in generational change, and I know that that's hard when there's there's holes in the bottom of the boat and we're just plugging it with toes and fingers and whatever we can find. But we have to have more holistic strategies. We have to have more long-term strategies. We have to move further upstream. And I think we really have to understand that holistic nature of mental health and seeing that it really is a rising tide that lifts all boats. That it's not just the absence of disease that we're after. We're after wellness. We're after wholeness. We're after lives that are full and well lived. And that prevents crime, and that prevents poverty, and that prevents addiction, and that prevents early death. It prevents all these things that we are spending so much time and money and energy trying to plug the holes of, and that we can strategically invest in wellness and in health, and doing that in a holistic and upstream and comprehensive way, and we can I think have a much more efficient and effective strategy if we can buy into that as a society.
I just make 2 points. One is a matter of public policy, and one as people. Until recently, Colorado ranked 48th in youth mental health. 48th. Totally unacceptable for a state as educated and affluent as ours. We ought to be leading the nation, not lagging it. So we're going to need allies at every age to press the legislature, the governor, decision makers at every level to lift our ranking. The good news, I guess, is when you fall to 50th, there's only one direction you can go. So we're moving up, but not much comfort. At a personal level, I'd just say this. We need to be sensitive to how we treat each other and recognize that mental illness is not a character flaw, and it's not a figment of the imagination. It's often a medical condition, and it doesn't have to be a death sentence. It's treatable. You can't legislate the changes in attitudes that we need to see, but if we listen more, talk less, I think we could make a difference. I'll try to fulfill my own example here.
Please join me in thanking our panelists for their time this morning. All right, you all, you've already seen this on your agenda. You get to go to lunch soon, but just sit tight for one more minute. I want to foreshadow what's coming up the rest of the day. You are not done with this panel if you choose not to be, except for Scott, and we know he has bigger and better things to be doing with his afternoon. But each of my fellow panelists will be a part of our learning labs later this afternoon, including myself, but mine will be more of a listening lab, or I will be learning from you. So if you have not noticed yet, on the wall to the side over here, we have a couple of walls set up to seek your input. We are doing some work to figure out what our role might be as the Colorado Health Foundation in supporting mental health and resiliency for young people. And we want to hear from you. You only have the time free to explore the questions and the ideas on these boards over your lunch break. So please take the time to go there and share your ideas. You can also join me and the others for the brief learning lab sessions, and you'll hear more about that format. But just know we are really interested in gathering your ideas to inform our work as well. And enjoy your lunch. Be sure to come back here at your seats at 11:45 for our keynote from Michael Lindsey. He's with McSilver Institute for Poverty Policy and Research at NYU. So more good conversation to come later today. Thank you very much.
Flowing off Dr. Lindsey's talk. First of all, we're going to start with introductions. My name is Ann Shimke, and I'm a reporter with Chalkbeat, Colorado. I cover healthy school topics as well as early childhood education, and now we're just going to move down the line.
Once again, Michael Lindsey. I'm not sure if I said anything about McSilver, but the McSilver Institute focuses on the root causes and consequences of poverty, and we address that through research. And most of the research that we do is focused in the space of mental health intervention, school. We target school dropout, and have a high school program for kids who are at risk for dropping out, food insecurities, those kinds of issues.
My name is Taylor Jordan. I live and work in Fort Morgan, Colorado, which is about an hour east of here. So kind of a rural area. I was, for the past 4 years, I taught ESL at the high school. And now I have the opportunity to work at the community college, working with the first generation students in the area, helping them decide what they want to do after they graduate from high school.
Buenas tardes a todos. Good afternoon, everybody. My name is Janina Fariñas, and I'm the clinical director of La Cocina in Larimer County. La Cocina is a program that provides mental health services, specifically Latinx mental health services, to youth in our community, including a 0 to 5 program, the Mil Días de Amor program, and a 6 to 18-year-old program, which is La Cocina itself. Thank you.
Good afternoon. My name is John McKay. I'm the director of the Department of Language, Culture, and Equity for Poudre School District. So we support our students, their emerging bilingual population. We also provide a lot of family engagement through our family liaisons. We work with all of our federal programs, Title I, II, III, IV. We also serve and work with our LGBTQ community, as well as after-school programming, interpretation, translation, in Poudre School District, which is a school district of 50 schools and 30,000 students.
Great, thank you. Let's get the discussion started. Michael mentioned during his presentation interventions that promote access to and use of mental health services among depressed youth in school. I'd like our panelists to start off by talking about some types of treatment engagement strategies that they've seen successfully used or successfully used themselves. And you can just jump in. We don't have to go in order.
I'll jump in.
Perfect.
So one of the things that we're trying right now, actually in partnership with PSD Schools, with John's group, is looking how ethnic identity can be a vehicle to destigmatizing Latinx mental health specifically. So one of the things that we know from research is that ethnic and racial identity formation, when it's strong and when it is really a protective factor for students, that it actually is protective on many, many different levels. And it has a long-term effect, positive effect, actually, on students. So one of our programs, specifically called El Grupo, which stands for Latinx Grupo, actually addresses how a student can directly learn to form their own ethnic identity and can use that to build self-awareness and social awareness. It has a very strong future orientation piece to us, which actually has to do with asking the question of what type of Latinx or what type of Latina or Latino do you want to be in the future? What do you want your impact to be in the world? And then really taking kids who would be understanding risk differently and reframing that for them in the context of health equity. This particular program is a 2-generation program. It's a 2-generation approach. And what this means is that while we work with the youth, we also work with the parents, both at the pre-adolescent and at the adolescent developmental stages. This may seem obvious, and to many of us, we kind of go, yes, of course, this would be really helpful to have the parents engaged, but the emphasis on ethnic identity formation, I think, is unique in that one of the things we're working with the parents on is for them to understand the biculturality that their children are actually experiencing, how they're living with that on a daily basis, how they're processing that. This is particularly important given some of our numbers for Latina youth, who are one of the highest at-risk youth for suicidality. So I would say that for us, making sure that this program eventually can be possibly offered within the school setting itself, and has a component to it that is both in and out of school, has become really the focus of our own future orientation, is really understanding how and destigmatizing this piece, ethnic identity formation can be the driving force. It can be the thing leading the effort.
Janina, just a quick follow-up question. Where is the program offered right now?
Right now, the program is offered in Fort Collins, Colorado. We're looking to expand it to Loveland. That's probably not going to happen until the spring, but yeah.
I love the idea of focusing on the future and making that kind of what we talk to students about. Fort Morgan is a pretty unique place. We have a combination of a lot of Mexican immigrants, and then recently we've gotten an influx of East African refugees, but then also some West African. And then we also have, this year, have had a huge influx of Central American immigrants. So it's just a wide range of needs and a lot of mental health issues that go on. For me, being a teacher, I'm not trained in it. I got hired at 24. I wasn't ready for it. But just being present with the students and making them know that like I was there as a support for them and I had their best interests in mind. I made sure parent-teacher conferences, I was there and engaging with parents. I learned a lot at parent-teacher conferences. So I just, in my experience and then hearing it affirmed today, just enforcing the importance of the future and what the future can hold for them is really a motivating factor for all students.
Great. Follow-up question for you also. You mentioned 3 different distinct kind of cultural or racial and ethnic groups. Do you do different things to reach those different groups?
We do. So we have different support groups for our different communities. And there's different needs in different communities, and there's different ways that you build trust. And so for our African families, I have learned that going into their home is a huge message of respect to the family. And so that's something that we prioritize. And a lot of it has just been kind of learning along the way, as we heard earlier. Like, you can't take the time to wait for all the research to come out. You have to really get close with the students and with their families and just listen to them and see what they need. And it definitely looks different for different groups.
Thank you.
So I think there's 2 different levels that we have to really address. We talk about the systemic approach at the district level. We do have 20 different family liaisons, 2 Arabic speaking and 18 Spanish speaking. And we really try to think about being future oriented and how to be inclusive of our practices. We talk a lot about equity, but with equity, you can't just speak about equity and not talk about cultural proficiency and inclusion. And really what we try to understand and foster in PSD is trying to understand what are the different cultures that are represented in our classrooms. Because being future oriented, also kids need to see themselves in the lessons and in the planning and the curriculum. And really we need to provide support to teachers to be able to help them understand how to have those conversations. So really when we only celebrate the iconic different cultural people that, you know, modern America and identity politics have identified, such as MLK or Cesar Chavez, we really aren't necessarily fostering all the different richness of cultures in the fabric of what makes our classrooms great. And so we've really tried to embark on a conversation about my heritage, our heritage, and looking at that collective efficacy of what that looks like in our classrooms, and how does that come about? How do we recognize that so that within, you know, there's lots of engineers and architects and doctors and social workers and nurses. And so when we have identity politics that are really giving a lot of negative rhetoric out there, and kids are getting overly consumed with and overwhelmed with all negative rhetoric, how do we create safe and inclusive classrooms that are really going to foster you know, their culture and let them see themselves in the learning? And what does that mean to them so that they have a voice in that? And our school board has done a great job of identifying some district ends, and one of them is connections. And we really are charging all of our practitioners in our schools to create connections. And we're talking with principals and saying, how are we guaranteeing that every student has a connection to at least one caring adult in the school? whether it's going to be a custodian, whether it's going to be someone in the lunch line, whether it's going to be a teacher. How are we able to recognize the individual attributes and strengths of students so that they're seen, so that we can actually talk about futures and being goal-oriented, so that we can make sure to create plans for kids.
Great, thanks. A quick follow-up question for you, John. Who does it fall to in the schools to make sure every kid is connected to an adult? Is that the principal, or who is that makes sure the buck stops with them?
Right. I mean, I think that's a great question, and I'd like to say it's every principal, but it's really a collective approach. It's an expectation from our board to our superintendent to our assistant superintendents, and we talk about it regularly. We just talked about it last week when we get in front of all principals and talk about, well, what do connections look like? What are students telling us? We send out a connection survey. We're able to drill down to the individual class level so that teachers can see what connections look like in their schools and in their classrooms, so that we're able to really understand what is the work that we have to do. And so it really is everybody's responsibility. However, we are certainly aware that unless it comes from the top, it may not happen.
Right. Michael, did you want to add anything?
Well, yeah, I think there are a number of ways by which we try to engage families. I think principally the one thing that is important in our work is that we distinguish between the sort of psychological or motivational engagement versus the behavioral. And so what I mean by that is we go beyond just telephone reminders or, child care and transportation, all those kinds of practical barriers that relate to why people are connected to treatment or not. Those are important. We definitely try to supply or have those available for families. But what the research suggests is that the psychological or motivational barriers can be even more powerful. So much so that, if a person is sitting across from you, it doesn't necessarily mean that they're there, right? And so how do you take that extra step to understand how to overcome those psychological barriers? And what we do is we, probe families and kids about their experiences in mental health treatment. Sometimes they feel the experience is going to be negative because somebody in their family or they themselves have had a negative experience. I'm reminded of a kid who said in his treatment sessions for depression, the therapist used to always go to the shelf. And I said, what does that mean? And he said she would literally go to the shelf, leaf through a book, and try to find my problem in the book, right? So that comes across as disingenuous and inauthentic, right? And so he said that, once he had that experience, he began to think, well, wow, this is the norm, right? These are the kinds of experiences I'm going to have with all therapists. So we try to, address those barriers. We do a lot of psychoeducation about mental illness. So in our case, oftentimes it's depression. We try to help the kids and families understand that, Michael may not want to clean up his room because he's depressed. And when you're depressed, you don't have a lot of energy. So we try to help families, caregivers understand that. And as I was saying at the close of my talk, I've not sat across from a caregiver who did not want their child to have success in school. No matter whether they dropped out of school themselves, they always want their children to do better, right? And so that's always the hook for me and our clinicians in our work, is that we always put the work that we do around mental health treatment in the context of school outcomes. And we have to do that for administrators as well, right? Because we take up time, we're perceived to take up time and keep kids away from doing their tests and all that sort of stuff, but we have to sort of ingratiate ourselves and help them to understand the importance of our work to their bottom line and ultimate outcomes. So those are ways in which we engage families and schools.
Mm-hmm. Great, thank you. The next question I'm really looking forward to hearing the answers to. So Michael already has described for us how depression can look really different for different youth. And I want to know if our panelists can talk about how resiliency also looks very different for youth in different groups, and why it's important for educators to understand and look for those differences in resiliency.
Okay, I'll start again. I actually think that I'm going to speak specifically about the Latinx community because that's really the expertise and the population that our team focuses on. I think that doing values identity work around specific culturally protective factors is really important when you're working with Latinx families and with youth. And the reason I say that is because there's a lot of literature out there that speaks specifically about, for example, the Latinx value of familismo, okay, which is essentially a love and respect for family, an understanding that family is going to be what's going to get you out of a difficult spot if you're in a difficult spot in your life. So really in the literature, if you research this, you're going to find that familismo is found to be a resilience factor. It's actually something directly connected to how Latinx families go through this. The thing that nobody seems to talk about sometimes is that what happens when the family unit is not working well? What happens when that resilience factor is not there? And I just think demystifying that for families is important because we can study about this, not always, but for at least in our program, trainees actually get to study about this. They get to learn about familismo, they get to learn about respeto, they get to learn about educación, about some of the fundamental Latinx values that seem protective, and then put them in the context of what's going on for a family, for example, who comes in and speaks continually about the differences that the parents understand or what the parents understand is happening for their child and what is actually happening for the child. And just so you know, a lot of people ask me, so what's the number one reason why people go to your program? And certainly we have depression, certainly we have anxiety, we have a lot of the things that you might anticipate. But the number one reason we have found in our data that people come to our program actually is intergenerational, intercultural differences, where there is something happening in the family unit so that familismo resilience is being challenged because the kids have one experience of being in this world and the parents have a completely different experience of being in this world. And they're not talking about it from that perspective. So what does resilience mean in that context? To me, it feels like, and I think we've experienced this, it feels really critical to speak about it from the perspective of resilience as being challenged. So I don't think it's that difficult actually to identify the actual resilience factors. I think it's more difficult to understand how to use them so that a family can move through a difficult situation. And I would add that it's particularly difficult to do that when a family, for example, is being challenged in the current political climate. So trauma is difficult to treat while people are suffering trauma. That's very difficult. And so how we talk about that ends up being part of this mix. It ends up being a really critical part of the mix of how do I remain resilient through a time and place in my life when all of that is being challenged. And I think it's inevitable that at some point something breaks down. So part of the way we talk about it, and to demystify it further, is we talk about how the rules have changed. How essentially the rules that used to apply to one particular culture are challenged by a different culture, and that the changing of that rules requires some kind of adaptation on our part. We make this explicit. We talk about it in community dialogues. We create dialogue spaces for youth that are white youth speaking to youth of color and really speaking explicitly about this and how those differences can actually be impacting the way a student does or doesn't clean up their room. That actually, that social context is very, very relevant.
Great, thank you.
Is it working?
Is the light on? Is the green light on?
Can you hear me? Okay. In my experience in the classroom, resiliency and seeing resiliency in students depends a lot on what their home situation looks like. And so for some students, resiliency might be that they like studied hard and did well on a test. And for some students, just showing up to school is resiliency. And so for me, what it all comes back to is having that personal relationship with the students. And I think this also ties back to our conversation earlier today about teacher burnout and how it is like a very tasking job and you feel like exhausted at the end of the day. And so what always got me through those days was coming back to like, what is your why? Like, why are you there? If you're just there for the job and to kind of check the boxes off, then it's gonna burn out. It's gonna get too tough. But if you're there for the students, then their successes are what feed you, and your interactions with them are what feed you. And so I think it's important for us to talk to our students about what their why is, but for us also to know why are we there. And I think if we have the right why and we have the right motivations and our hearts are in the right place, then we won't burn out, and it'll be something that actually invigorates us.
So, I mean, I think that we make a lot of assumptions about what resiliency needs to look like based on our own experience. And I think that's based off of our own fixed mindset. Kind of our experience is the experience that we give to students in our classroom. So your idea of what a high school experience should be like is what we try to reproduce for what kids are in our own hallways now, where we have different types of learners, we have different multisensories, that, you know, kids are resilient. I think this idea that they're not willing to walk to school for 2 miles through the snow is a generational concept where, you know, I live now maybe 1.5 miles away from my school, and maybe 3 blocks away from my high school. I have twins, and they're in 6th grade, and I told them, in high school, you're just gonna have to walk. There won't be a bus. And they're like, but what if it's cold? And I'm like, well, wear a sweater and not shorts in December, thank you very much. And I think that the reality is that we have to be asset driven and really look at the strengths of children and really have conversations with them to understand, what does resilience mean to you, and honoring student voice in that. And when you talk about different types of demographics or different cultures, I think the foundation that we always look at first is an indicator of poverty. And then you look at different indicators that are really kind of marks against a family or a student, whether they're a student with a disability and in poverty. Then they might also be undocumented, or we might have students that are part of our LGBTQ community that, you know, whatever fixed mindset or experience they're experiencing might also be considered, a deficit. However, that's resiliency in a lot of ways for what they're experiencing. So when we talk about resiliency and the assets that students bring, we have to honor the student experience and try to say, so what does that mean to us, and what is our own fixed mindset? Because the experience that we provide for them gives them the opportunity to really shine and be able to see what their resilience really means. I've worked with a lot of newcomer families, and when a student has the most they're more fluent in English than their parents are, and they're the cultural navigators for a lot of business that they have to get done at the doctor, or if they're going to the bank or at the grocery store. Their resilience might look really different. We also have a lot of students that are experiencing homelessness and unaccompanied homeless youth, and what does resiliency look like to them? So really understanding their story and then trying to figure out what are the tangibles that we can do. I absolutely agree that there's some basic necessities, and I think sometimes those are the easiest. And I used to be a counselor, and the hardest thing to do is be in front of a family, in front of a student, and not really know what to do or not know what resources there are to be able to support them. And so really digging into their story and trying to understand what resources and strengths they already have in their system to be able to say, oh, well, then there's some natural identifiers and I can make connections. And being that bridge to that is some of the first indicators to understanding where does resiliency start, and knowing that you're partnering with them in that journey.
I was sort of waiting for this question because on the pre-call for this trip, we sort of talked about resiliency, and I come at resiliency a little bit different than than probably most. So I tend not to use resiliency. And even at the Institute that I direct, we tend not to as much talk about resiliency. And I'll tell you why. I think the concept can become dangerous in a sense that if one child is resilient and can channel through all of these different types of turmoil and the other child can't, then one child gets labeled resilient, the other child does not, right? And so you don't have a full appreciation for all of the contingencies that one person has to go through from the next, right? And so then it has the chance to go into this slippery slope of exceptionalism. And so I think what we're describing is persistence, right? How do you channel persistence and help people to, fight through circumstances? The other issue is that, okay, going back to the scenario of the child who was resilient versus the child who wasn't, oftentimes when we label resiliency, we're labeling it in an individual sort of way and not really critiquing the context that creates these circumstances that would render someone to be resilient or not, right? So I've become burdened, for example, by only delivering mental health interventions to kids and not doing anything about what circumstances precipitated those mental health symptoms to begin with, like what's happening in the community, what's happening within the family, in terms of not working with kids in isolation of their family, or not working with families in isolation of what's happening in the community. So I think we need to have like multi-level kinds of interventions to address the multiple layers. I know that's really far-fetched and lofty, perhaps, but I'm very careful about the framing of resiliency and what that means without being critical of context.
Mm-hmm. So, related question, resiliency in some ways could be seen as another word for perseverance or persistence or strengths. And so do you just get away from using all that language?
No, I think if a person has circumstances that they're trying to get through, right, we definitely want to promote their persistence. But I think in the way that we kind of think about how to, so we have that resilient child and we try to, or that person that's overcome those circumstances, we try to bottle it up and then carry it to another kid and say, oh, well, this kid came from a similar circumstance, right? If he did it, then you can do it too. Mm-hmm. And that's not always the case. So I think we encourage individual level, persistence as much as we can. I just get concerned about the kind of branding of resilience.
Mm-hmm. Okay.
If I could add something. Thank you very much for that frame. I'm really appreciative of it. I think that I am really appreciating the fact that you're acknowledging this larger systemic context, which I think, unfortunately, this issue of resilience does get lost in. We sometimes do explain resilience to our community members, our constituents, as the ability to bounce back, and we show them like a little resorte in Spanish, a little spring in English, I think it's called, right? A spring. And so for me, I feel like, okay, so we can certainly share that and we can demystify that and we can talk about the importance of having that because we do want our families to be persistent. But there's always a part of me that's going, why are we asking them to do this over and over and over and over again? There's a repetition that happens actually where it begins to feel like there is an inequity, and the inequity becomes obvious over time if you're paying attention of how communities and individuals and families are being asked to be resilient and what that does to a community over time.
Anybody else want to comment on that? Okay, let's move on to the next question. Can you give examples of how you see positive youth development being incorporated into schools?
I can start off real quick. I have a great example. At the McSilver Institute, we have a program that targets kids who are at risk for high school dropout. And we work with them from 9th through 12th grade. And the program is framed on positive youth development. So instead of calling the group, a mental health treatment group, we label it differently. And the kids actually label it in accordance to what they think it is. So they may call it, sharing or supporting one another. And the program is one-to-one mentoring, and it's group mentoring, and then we do some exposure to activities, but all framed around positive youth development. And what we found is that when we work with kids from 9th through 12th grade, 93% of those kids actually go on to college. And these are kids who are in really tough neighborhoods and school situations, family situations, but just that positive youth development frame for them and working with them for all those years really leads to robust outcomes. We also find that our outcomes for kids are better than New York City's in terms of high school graduation rates, particularly for ethnic minority youth. So it's about a 12 to 15% differential when we work with kids. So that's a great example of how to frame the work that we can do around positive youth development.
And how do the students get picked for the group?
They either self-identify or nominate kids. So it's sort of like they frame it as, an opportunity to kind of hang out and get support, but they actually tap kids who they feel like among their friends really could use some extra support. So if they have a friend that's not showing up at school and that kind of thing, they might recommend that kid to be a part of the group.
Okay, got it.
Evidently, it's my turn to talk. So we do a lot of character ed. We do some mindfulness work as well, so that people are really able to start understanding where they are. And we've been doing that at the elementary level and slowly growing it to the secondary level. And some of our high schools are really adopting that. Our youth development program really encompasses the 5 C's, which is competence, confidence, connection, character, and caring / compassion. And then we've added another one, which is contribution, because we really want then students to be able to self-identify and also work with one another to have that peer type of recognition, friendship type of benches out in the playground, and just trying to make sure that students are able to recognize the assets and also the support that one another need to be able to create a really enriching environment. And that really starts at the elementary level. It's that we try to foster through the secondary level. And we really look at then what does bullying prevention and things do. I know as a principal, I'd always ask my office manager every morning, so what has Facebook done to us last night? And so because we're always responsive for these things, and we're responsible to really be able to attend to them. So doing things like having all school gatherings and really being able to have real talk with kids and saying, hey, here are the issues that are going on, and taking pride in that so that people are understanding that this is our community. We'd always talk about that our school is a sacred place of learning, and that place is your place, and how are we going to foster that so that people really understand that they have just as much responsibility in this, and that there's a dual accountability. Oftentimes schools are this archaic way of thinking that teachers place upon these responsibilities and expectations on kids, and they can't have any expectations of us. And I think through some of the mindfulness work and some of the self-accountability and the self-awareness piece, really it should be flipped. The students should have the responsibility and hold the responsibility to hold us accountable as educators to understand their needs and really create these amazing learning environments. And that's what we want as well. But if we don't develop that sense and also that, mind frame for them to say, hey, I can expect that of you from the very beginning, then we're not ever going to get there at the secondary level for them to say, hey, I challenge this because I want this, and this is what I'm really trying to attain, and this isn't rigorous enough for me. How can you help me? And that self-advocacy on their part then brings teaching and learning kind of to a partnership, a way of thinking, instead of us saying, well, these are our standards, and you've got to learn these standards, and you better memorize it this way, and we've got to do this. They can say, oh, there's lots of different ways to learn that, and these are some of the things that I need from you.
Interesting. Just one other thing I wanted to add. So you mentioned kids challenging the adults and holding them accountable. That can often look like maybe defiance or, causing a problem. Like, how do you navigate that tension?
Right, I think it's through self-awareness, looking at data as well. I mean, our data is very similar to the national trends. We do have a higher graduation rate of our Anglo students than we do of our kids of color. We're working on that. We do have higher disciplinary, incidences of kids of color than we do for our Anglo. Then we try to correlate what does that look like for kids in poverty. So we're not there yet. It's not this perfect utopia. But one of the pieces that we really need to understand is we have to create that awareness so that it becomes an expectation. And we also have to understand, like, learning is messy. It's not this linear way of thinking that you're going to learn this, and it's there's lots of pieces to the puzzle. And in our learning environments, we want it to be loud and messy, and we do want to challenge each other so that we're actually challenging each other's thinking so that we can actually improve as a larger system and community. And as we start to foster that type of personalization, we hope that then teachers can say, oh, they're not really challenging my expertise, they're just challenging the way that we're engaging in the learning, and maybe I have something to learn from these students as much as they have something to learn from me.
Great.
I would just add that in our program, because we really consider ourselves a social justice program, I would encourage you to think that racial identity and ethnic identity is very much part of social emotional learning. And the way that is incorporated into the school setting is actually fundamentally critical at this time in our history.
Great.
Along with that, I think the peer mentoring programs are the most effective thing that I've seen. I've been working with CSU for the past 3 years, and we bring key communities out to the school, and then we also take the Fort Morgan High School students out and visit key communities, and we have different activities for them, and so they can see people in higher education that look like them and speak their same language, and so then they can see themselves doing that also. And so from that, this year I've also been able to bring it to our community college, and so we have peer mentoring going on there. And then at our high school, we're starting a peer mentoring program. And so if there's any ideas you could take back to your schools, I think starting some sort of peer mentoring or just people sharing that experience together and getting to talk to people who they can relate to better than adults usually.
Awesome. We're going to quickly jump to our last question because we're going to wrap up in just a couple of minutes. We've talked a lot about kids, and we have touched on parents as well, but I'd love to just come back to the issue of when we're talking about mental health in schools. How do you communicate to parents when maybe they're not in the school as much, or they're not right in the situation? How do you communicate to parents about mental health supports and also the issues around what we've talked about already, stigma or resistance or being culturally appropriate or relevant?
So we host lots of different events, and we really promote a lot of different activities. So one of the things that we do annually is a learning conference for parents that we invite all families to, called Mental Health Matters. And we have lots of different sessions and different topics. We also, in my department, host specifically what we call our Parent Academy, which is really supporting all of our linguistically diverse families to be able to come and learn on different sessions and topics that they're most interested in. And a lot of it has to do with mental health. What do I do when my child is doing this, or what does depression mean? particularly at the very beginning when marijuana was first legalized. They wanted to be like, so my kid can smoke pot now. And we're like, no, like there's lots of different things that we need to educate you on. And so we do an assessment and do a survey so that they can inform us of the things that are most relevant to them. And oftentimes mental health comes up as one of them. Anxiety, we talk about how do I help my child with my homework, and it leads to all of these natural actions that are happening in schools are associated with social emotional health and well-being. And so how do we really get to the root of the problem and really address those components to be able to ease the daily grind of being a parent, going through the rigor of life? And so that's how we do it. We basically have also individual evening events at a lot of our schools that have parent liaisons. They host things that are developed through a parent engagement plan that they're able to, a year-long parent engagement plan where they map out what are the real engagement strategies culturally. So if you have homecoming and you have a newcomer and it's Spirit Week and the student's like, I need to go to school in my pajamas because everybody else is, and the parent's like, there's no way you're going to school in your pajamas. Or what is prom? What are some of these things that are important? And those things are social emotional that lead back to the mental health piece. And so we do things that are very specific to the rigors and the routines of school, but we know it actually leads into the mental health and social emotional well-being of kids and families.
Great, thank you. And we probably have time for one more answer, so if anybody wants to jump in, finish it up.
Well, I would just add to what John said, actually. We get to work together on many projects on our community, and so I both applaud the work that his team is doing and would add to that we are continually invited by them to include the topic of racial inequity actually into the conversation, to speak with parents openly about it, and to speak about what and how the current political climate may be impacting their children's social emotional well-being. Demystifying that actually really reduces stigma and increases a sense of community resilience. So once again, I encourage you to make those part of the conversation.
Great. Thank you so much. Please help me thank our panel.
All right, thanks guys. Are you ready to stand up and walk around a little bit and be interactive? So for the next hour or so, and I'm sorry, I don't mean to stand in front of you. For the next hour or so, we're going to be engaging in a whole bunch of different learning labs. So in this room, in the next room, and outside in the lobby area, we have 7 or 8 different learning lab stations that we're wanting all of you guys to rotate through. So each learning lab is going to be about 15 minutes. You're going to have time to rotate through 3 different labs. And we would encourage you to just be cognizant of the number of people at each lab. If there's a lot of folks at one, try to move on to another one. And in terms of the topics that will be covered, we have a piece of paper that you should have received at registration, and maybe up on the screen? Nope. Okay, it's coming. And also in the back of the room, we have a couple staff members who have lists of all the different learning labs. So if you guys want to get up and stretch your legs, walk around for a little bit, enjoy yourselves, and our staff will be coming around and helping people rotate through as well. Thank you. Oh, and please join us back here at 2:15 for the final session with Karen.
Okay, thanks. So did you make it around to 3? You wish you could have done 4 or 5? Yeah, I believe it. At our large summer symposium this past year, we focused on behavioral health, and we had David Sheff, the author of Beautiful Boy, to speak, as well as his son, Nick. So we have extra copies of both their books. They'll be probably on the table as you walk out, so feel free to grab a book, The Beautiful Boy, or, and I forget what Nick's book is called. What? I didn't understand you. But that book is out there. All right, you've been listening a lot today, so now I want to give you a chance to participate and talk. So we're going to do essentially kind of a rolling panel discussion. So I'm going to ask the first 4, 5, or 6 people who might want to come up and join me. I'll even tell you the first question, which is, what are you seeing with the young people that you work with? And you can come up, answer that question. We'll just continue the conversation, and then when you're ready to go back to your seat, you can, and somebody else will come and take your seat. So we'll just do over the next 30 or 35 minutes, we'll just do a rolling panel conversation. So who are the first folks that want to come up and talk about what they're seeing, at least talk about what they're seeing with the folks that the young people that you're working with? Come on. I have great patience. You coming?
I know you're looking at me.
Well, you were headed this way. Nobody wants to talk about what you're seeing with the families you're working with? All right, so just hang them right there. Come on, come on. There you go.
Thanks. Appreciate that.
All right, so we'll get started with you all. So what are you noticing, Lindsey, that the young people you're working with are struggling with?
So I work for Catholic Charities in Pueblo, and I work on a early childhood social emotional development project called Launch Together, and it's a community-wide initiative that's really focused, like I said, on that early childhood population. And so I think some of the things that are most surprising to me are just the severity of the issues that we see with preschoolers. We have a really large rate of preschoolers that are being expelled from early learning centers, and I didn't think that was a thing until I didn't know you could actually get expelled from preschool until I started working in this field, and just to see the impact that early childhood mental health consultation has had on our early learning centers across our community, and really in some targeted neighborhoods that are at most risk, and to see the benefits that we're seeing in really 2.5 years has just been, it's been really, really inspiring. And I think that's something that, as we look to prevention as a means of obviously, keeping things under control later on in life, I think we're going to see a lot of really great outcomes from the use of mental health consultation.
Thank you. You guys got some mics over there somewhere.
So personally, as a youth, I think it's hard for others to find comfort in adults and in other youth. I know it's one thing to say, oh, there's this program that you should be in, but it's also another thing for someone to recognize that they have a problem or that they need help. Do you have anything to add?
Oh, okay. So
I think so.
Hey.
It does.
Oh, it does. Okay, good. So I think there's a lot of energy among youth. We saw that with March for Our Lives. We're seeing it now with our organizations like Koyaku and Rise Above Colorado is another one. We've got so many youth across the state that are getting involved. And I think with this past midterm election especially, we got a lot of new voters that are getting involved as well. And midterms are not popular events for young voters, so to speak. So I think it's great that young people are getting involved in the conversation. And I think with mental health specifically, they're actually making a difference. Somebody in one of the panels, I think, mentioned how 10 out of 11 ballot initiatives regarding new mental health resources passed throughout the state. And one of those was in Larimer County ballot initiative 1A, and that passed resoundingly, and I think young people played a huge role in getting that through.
I teach technology and computer science at Heath Middle School here in Greeley. And so what I see is a lot different than a lot of my core teachers have seen in our classroom. But I see my kids admit to high anxiety due to being on social media and lack of sleep because they want to play that game all night long, or they are getting a lot of negative things on their feed. I do a survey in my class about what kinds of things that they're seeing, and then I actually compare it to the national average so we can see what kinds of things are they seeing, what kind of things are the whole country kind of looking at, and then how does that affect us emotionally? How does that tie into something like empathy and understanding where other people are coming from? And then also a lot of them are experiencing technology addiction. There's sixth graders that are telling me that they have a hard time just turning off their phone, or if they're having experiences with cyberbullying, that simple block button, how that just eludes them, that they can control the things that they're seeing and they can control how they react to those things. So I'm having a lot of trouble with a lack of empathy with my kids, and they're getting a lot of this anxiety, depression, and these kinds of things are feeding on their experiences, not just at school in that setting, but when they're taking those things home with them. Now the bully is not just at school, but it's also at home with them. So understanding where that power comes from, how they're interacting with technology, and then also how technology affects us in the real world. There's some kind of a disconnect for our kids.
Now remember, you can come up and join at any time. But are young people talking to each other about this? Do you having conversations with each other about stress or anxiety or bullying?
I think stress. So a lot of kids approach it as like, oh, I'm so stressed about school. I'm so stressed about like my homework assignment, but nobody really covers outside topics like what's going on with their family. Everybody kind of just, once they get to school, they put it aside and act like everything's okay. And some people do post on social media and say, like, they'll post a sad quote or something. And I think that it is so that they hope somebody will reach out to them and try to make them feel a sense of comfort or like an extra connection with each other. But personally, I don't really see many people reaching out to their classmates to seek help or seek advice about how to overcome anxiety and stress or depression.
Yeah, so she kind of touched on it. I think the issue with school culture these days and with mental health is people wear their mask to school. They don't talk about personal problems. School is for talking about the next test, my final, oh, hang out this Saturday, let's get ice cream. It's not for these personal things. And I think that's an issue in a way. People are feeling trapped. They don't necessarily have that authority figure or that friend that they can open up to. And as young people, I think we kind of aim to try to be listeners, but we don't necessarily try to reach out to people we might think are having problems.
And I want to ask anyone to come up who wants to talk about, like, what barriers are you facing as service providers or as teachers? What are the biggest barriers that you face to being able to adequately or better support the young people that you're working with? In the meantime, Lindsey, what gets a preschooler expelled from preschool? Oh, I'm sorry. I'm just ready to listen to you.
I think it can be a lot of different things. Most frequently, it's the teachers not necessarily being able to understand the behaviors that are being exhibited and realizing that those behaviors are not necessarily because the child wants to act out in the middle of class, but because it's something deeper and it's something that is related to, maybe something that's going on at home or attachment or whatever the case may be. And so many times it's not, kids, they don't want to throw a temper tantrum for the sake of throwing a temper tantrum. Like, they're trying to get at something deeper. And so we've done a lot of work in Pueblo around kind of understanding the adverse childhood experiences and how those transfer from one generation to the next, and really using kind of a two-generation approach to be able to say, how can we make sure that these kids that are going into preschool now are not experiencing the same traumas that their parents faced when they were little? Or how can we equip classroom teachers or early childhood center directors with time management skills, with classroom management skills, with understanding and using different curriculums to better understand where these behaviors come from and why they're exhibited in the way that they are, and not just taking them for it's a 2-year-old tantrum.
We heard a lot of tragic stories from our speakers earlier today. Has anybody got any success stories? Any good news? Come on up if you have. What's working? Who have we saved rather than who have we lost?
Okay, so my story is a success story, and only kind of recently. So a couple years ago, like beginning of high school, I was diagnosed with major depressive disorder. And that whole process of trying to figure out what medications worked or what the right doctor was so laborious, and it was awful. And like going through medications, it really, really sucks, because antidepressants are not kind to your body in the start at all. So either they make you feel worse, or they make you throw up all the time, or like sleeping issues. Like there was one night where I just couldn't sleep at all, and it lasted for weeks. So, all that horrible stuff. And recently I got a combination of antidepressants that really worked for me, so I'm all good now. So
excellent, congratulations. How did your story start? Did you go to someone, or did you notice a change in yourself?
So that's also a really long story too. And it started with, I told my mom that I didn't feel very good. I told her that I felt depressed. And she was like, okay, that's probably just a teenager thing, don't worry about it. And it kept going on and on and on. And I was like, Mom, I can't. I really should go see someone. So she took me to a psychologist, and that psychologist is like, yeah, you probably have something. I'm going to give you to a psychiatrist. And then that psychiatrist gave me to a therapist, so I was working both with the therapist and the psychiatrist at the same time. And then they asked me to go to a class that was like a life skills class, so how to deal with your depression or any other like mental illness. And yeah, so it was a really long process of different doctors and different medications and different resources. So
Great, thank you for talking about. You see how the youth are stepping up in this conversation? Yeah. Do you have something you want to say, Kyla? Did you have something? Okay. So no more success stories in this room? All right, come on, great. There's another one at the very end there.
Does this one work?
Yeah.
Okay. Can I do a vicarious success story? So do we have folks from next door in Larimer County in the room? Oh, there we go. Yeah. Are you guys, from Poudre School District or? Cool. Great. I work with the State Office of Suicide Prevention and the Department of Public Health and Environment. And we have a grant from the federal government called a State Innovation Model Grant, or SIM. And that includes a population health portion. And it's really focused on integrating behavioral and physical health. And one of our grantees is the Health District of Northern Larimer County. And they have a program called KAYAK. And I think I'm getting might get the acronym wrong, but like Connecting Adolescents and Youth to Care, that final AC, I'm not sure if I'm getting that right. But they have a model where they've co-located like a psychologist or other mental health professional at the school and sort of designated them as an ombudsman of sorts for kids who might be at risk of suicide or have other mental health issues. And we've heard a lot of like individual personal stories, which have been really powerful, including one of our researchers at the state who does evaluation for us actually is the parent of someone who was helped through that program. And just having that practitioner present in the school overcomes some of the privacy barriers and the issues about information sharing and coordination of services, and even just being able to let the parents know. So we had a presentation from them recently at the state, and it was really powerful. So there's a success story, and before I put this down, I just wanted to put a pitch in to everyone because at the state, we talk about shared risk and protective factors as like this overarching strategy, and we see youth suicide prevention and mental health promotion really as kind of inhabiting the same space, and all the strategies that help one can be used for the other. So when we've had like these public health emergencies over the last few years, there have been some food contamination outbreaks. There have been recently there's like this myelitis disease that is causing kids like a lot of health problems. There have been some fatalities, and right away there's this infrastructure where the state and the CDC send out information and let people know here are some concrete steps you can take. Look for these signs and symptoms. Once you see the warning signs, here's what you're supposed to do. And people follow it because they know, oh, this is a contagious disease. We need to nip it in the bud if we see a symptom. This last summer, the CDC published its vital signs report on suicide in the United States. And over the last 30 years, suicide really has exploded nationwide. It's really acute among older working age men, but it's also true among kids. And obviously, it's the whole mental health stigma problem. We don't treat it as the same kind of emergency as we do with these infectious diseases, but the mortality and disease burden is much, much higher. And it's kind of the same with opioids, too. It's weird to see how those two things don't always get mentioned in the same breath. But teachers and people that see those signs and symptoms first are the first line of defense and the best hope that a lot of people have in terms of connecting this body of knowledge to saving lives. So there's a tremendous amount of power among all the teachers to sort of be public health workers and
not to sound cheesy, but warriors, like going beyond, above and beyond the call of duty. You guys already do it for your students. And taking all this knowledge around mental health and viewing suicide as a crisis that you all are on the front lines of helping us to stop is kind of the state of Colorado's perspective, and look forward to working with all of you more on strategies to keep kids healthy and to make mental health a big cause in public health in this century. So thank you all very much.
Thank you. And someone else with a good story to tell.
Hi, I work with Denver Public Schools and I'm a nurse. And I just wanted to put out a success that in a couple schools we've implemented kind of like that mental health screening, and it has been so successful. And I know that sometimes we get pushback from time and resources and things like that, but we have screened for safety and had great success, helped students get help, figure out how to manage medications, maybe to find community referrals and resources and just partnerships out there. So for everybody who's doing that, thank you so much, and it has helped our community so much.
Thank you. Any other best practices, promising practices going on that you were excited to talk about? Come on. Take a seat.
Okay, I'm Tanya Russell. I work with the City of Brighton, and I work with here on the Brighton Youth Commission. And I think that this just became even more clear to me today as Hero sat on the stage. And it's the partnership and the collaboration that's going on. Really, so the Youth Commission does Speak Week, and in the really gritty part of planning it, it can really feel like it's us trying to fight this big battle on our own. But seeing Scott from Sources of Strength, the city had partnered with Sources of Strength and School District 27J to make sure that Sources of Strength took place in the school district at the same time that the Youth Commission is working on Speak, so that was a natural tie-in. Then we've worked with other mental health agencies to collaborate with that as well. So I guess the success is that realizing that we're all in this together and we're all working in it together. And even if it seems like it's really hard work, it is hard work, but your partners are here. We just need to reach out to them.
Any other good stories? Good. Then I'll forecast the last, kind of our last question for you to think about. Given that we're a funder and we have resources, and clearly the need always outstrips our resources. However, I won't let the opportunity pass for you to come up and say, here's what I could do so much more if I had just a little bit of money. So who wants to come up and answer the question, if I had just a little bit more money, I could you fill in the blank.
My name is Amy Downs. I'm Executive Director of Family Star, and we are an early childhood organization. It's also a Head Start center. About 80% of our children are below poverty and 40% are homeless. And we are able to bring behavioral health services into the school, but our approach is also to support the caregivers and the parents. So our success stories are when we can help parents find housing, when we can help them find behavioral health services, food security. It's amazing the turnaround we see in young children in terms of any behavioral issues that they're having in school. And so one thing, I was really struck by with the keynote speaker is her real emphasis on the importance of prevention of behavioral health issues at a young age. And even though 80% of brain development happens in the first few years of life, when you look at the resources we spend on behavioral health, it's really not necessarily in those early years when it is when some of those challenges are first being faced. So we have a lot of success in terms of that 2-generation support and really trying to engage parents more in terms of helping them stabilize their lives and creating a nurturing environment for the students to come home to. We can have that nurturing environment during the day, but they really need to be able to come home to that and have that support in the evening. So if I had just a little more money, I would put even more resource into helping the parents, support the parents in their journey in terms of having their needs met, so that their children in turn are in a stable environment.
And you mentioned, students' behavioral issues are because they're hungry.
Mm-hmm.
And as adults, we understand that. We even talk about being hangry.
Yeah.
Because we know we're not at our best, and we're irritable, and we're not focused when we're hungry.
Right.
And we're the ones who have fully developed brains and have had years of developing emotional stability. And so why would we be surprised
Exactly.
that a child would act out or be distracted if they aren't full?
Right, and when we're hungry, we know that feeling is going to end soon once we, get back home or something like that. But for children, they don't necessarily have that.
Any folks want to say what you could do with this little bit more money? I knew Lindsey was going to jump at that chance.
So many things. I think for us, the collaboration across our community has been something that we've been doing for a long time in Pueblo, but to really be able to have that backbone support to drive initiatives forward is not always a fun funding priority because it's hard to measure a lot of times that value of collaboration. And so it's a little harder to say we served X number of kids because we all came around the same table. But that systems level approach of being able to coordinate systems to make those referral pathways something that is easier to access in our community, that takes time, and that takes money, and that takes effort as well. And so I think to be able to have that opportunity over a long period of time through our community and through that consistency, because we even know with children, consistency is key. If we're able to provide that to the organizations that are working on these issues over a longer period of time, I think we'll ultimately see greater impact.
Thank you. I'm going to give the young folks last word. With Brighton and with Koyak, what could you do more in your work if you had a little more money?
Okay, so with Koyak, wait, is it on? Can you hear me?
Yes.
Okay. With Koyak, we are funded some money from the state legislature, but I think with more money, we'd be able to outreach to more youth. Colorado is pretty big, and having only 45 students represent all of Colorado doesn't give us enough, I feel like we could get more perspectives with a little bit more money. And specifically with mental health, it would give us the opportunities to have our youth come to more symposiums and conferences and learn more from experts about mental health.
Yeah, kind of adding on, we get $25,000 from the legislature, and in previous years the council has been smaller, but since Cheryl took over, the council has been growing larger and larger. There have been empty seats in previous years before, but now we're pretty much full. We have 38 right now, and running such a in-depth program and trying to get these people from rural communities all the way out here, hours from Denver, and then still having to reimburse them for their travel, $25,000 for 40 kids for 4 meetings a year is stretched very thin. So with more money, I think that Koyak at least could definitely take advantage of more opportunities to, say, have someone from Durango be able to come up here and speak to you about maybe their mental health experience and actually get the rural perspective rather than people who are closer, at least for youth.
For the Brighton Youth Commission, with money, we have to raise all the money ourselves for the most part. So sometimes the city gives us money, but most of the time for like big projects like Speak Week, we have to raise all the money ourselves. So we have to do like call centers and call like all the organizations in Brighton and say, do you want to sponsor Speak Week? And so with more money, that would be nice. We wouldn't have to like fundraise so much. And of course, with more money, we could make the programs that we already have, have more resources or, be even better than they already are, or come up with like new programs for different things. So, yeah.
Thank you. And James, did you want to comment? Oh. All right. So let's thank all of these folks for their willingness to come up and share. If you all just stay put for a second. I want to close out by thanking you all for giving this day to this topic. I know you actually give most of your lives to this topic, but to giving this day to for us to dive deeper with you. I hope that you found some new information for you, something that might have been an insight or something that you can take back and say, we could do that, or we need to address that, or this is something that we've got to put higher on our priority list. So again, on behalf of the Colorado Health Foundation, thank you for coming. Everyone have a wonderful holiday season and drive safely.